today. The first speaker will be Dr. Rupa Joshi. She's the transformation lead for BSLM, and she's a GP and works in general practice as well as working for NHS England. She's a great advocate for group consultations. So she's going to talk about what lifestyle medicine is and how to access help as a practitioner, whether you're in the NHS or in other places. So I'll leave it now to the team to take over and guide you through the day.
So it's really good to be here. And I'm really excited to be talking about lifestyle medicine. And I think, you know, we do talk about lifestyle medicine a lot and how we can really help our patients with lifestyle medicine. But I think in this instance, this is a day just for us. It's how do we look after ourselves so that we can then look after others? So how can we put the oxygen masks on ourselves first? So thank you for the introduction, Francis. So I'm the transformation lead at the BSLM, and for anybody that's not come to one of our events before, a warm welcome to you. And for those who are members, it's really good to see you back again. Next slide, please. So we're going to talk about just really an introduction this morning of what is lifestyle medicine. So for me, lifestyle medicine, I think the key takeaways are that it is completely evidence-based. So everything that we will tell you is all based on evidence, and it's been, in trials, it's proven. And it's about meeting the person where they are within their socioeconomic circumstances. So whether they're, in a busy job like we are, whether they've got financial problems, whether they've protected characteristics and so on, and then using behavioural changes, skills and techniques to really help our patients to understand how to set goals, how to make that change in their lives to really improve their health. And a lot of us really think about lifestyle medicine as a prevention. But what I want to say is that it's not only a prevention, but it's also a treatment, and in some cases as well, a reversal. So things like diabetes, hypertension, in those instances, you can really reverse a condition using lifestyle medicine. Next slide, please. Yes, and it's about other things like the 6 pillars, which I'll go on to. So this slide is really about the non-communicable diseases that are really rising. So when we look at the evolution of 100 years ago, we had people with infectious diseases. Now we have vaccines. Now we have antibiotics. We've got new ways of treating those. So those non-communicable diseases are really coming to the forefront now. Next slide, please. And when we're thinking about, what is the percentage of communicable diseases in the UK, you may want to hazard a guess, but next slide, please. So it's actually 89%. So everything that we're dealing with is a high percentage of non-communicable diseases, and the majority of these are preventable if you use lifestyle. Next slide, please. So as healthcare professionals, we are part of society, aren't we? And so whatever applies to society applies to us. So things like smoking, drinking, diet, being overweight, low physical activity, 98% of us live with one of those, but 60% live with more than 3 of these behavioural risk factors. And when we're looking at things like tobacco, blood pressure, this graph's really interesting from the Global Burden of Disease study, which really tells us the number of years of life lost with some of these conditions. Next slide, please. And I think when we're looking at the science of lifestyle medicine, many of you will have heard of epigenetics and how our genes can be masked by a good lifestyle, but things like stress and a lack of sleep can really, modify some of the gene expressions so that they actually come out. So hiding some of your gene expressions you can do with lifestyle medicine. And many of you will have heard about the gut microbiome and the fact that we have a gut-brain connection, and it's very much dependent on lifestyle, stress, the diet that we eat, some of the harmful substances that we might consume. It's a very delicate balance, and our immune system is mainly in our gut microbiome, so we need to look after that as well. And many of you will look after patients with things like chronic fatigue or cancer patients, and the mitochondria is our powerhouse. It's our energy making in our cells. And it's also what causes aging as well. So every day our mitochondria replenish themselves, they break cells back up again. And there's lots of evidence about physical activity being the forefront of mitochondria to make sure that we have that really good cell turnover to keep ourselves healthy and well in the future. Next slide, please. And as I said, with society, within our healthcare systems, we have people with protected characteristics, with financial problems, with sometimes income problems, housing problems, and this applies to all of us. Not only our patients, but all of us as well. That our health-seeking behaviours, we can get very stressed because of our jobs. We have work long hours. And we know that healthcare workers have a higher incidence of alcohol use, social isolation, anxiety, depression, and having things like complaints and bad days with your patients can often lead to a lot of stress. And we really need to look after ourselves with keeping to those healthy behaviours and having social networks, and particularly peer-to-peer support and a good working environment that we can support each other if one of us have had a bad consultation or something that's really stressed us. Next slide, please. And I think this slide's really interesting about 10% of healthcare being due to the reasons for our behaviours and our environment are much more than just the access to healthcare. So things like genetics, behaviour, socioeconomic circumstances, those are the things that we really need to be looking at to look at how our health needs develop. Next slide, please. So what isn't lifestyle medicine? So lifestyle medicine is really more about the individual. Public health looks at mass scale development for communities, but we are able to influence those communities. And it's not about blame, and I think that's really important. So it's not about looking at people with obesity and blaming them. It's about understanding their personal situation and their circumstances. And it's not about complementary or alternative medicine. As I said, this is very, all about evidence-based. And we don't look at tests and things like that, such as functional medicine might do. But this is, really about lifestyle medicine, about using the 3 principles, which I'll come on to. Next slide, please. So this is still in being developed with the graphics and things like that, but this is an older version. But like I said, it's all about assessing a person on their social determinants and then using those skills to really wrap around and then addressing the lifestyle pillars, things like nutrition, well-being, physical activity, sleep, harmful substances, and social isolation. And when we're thinking about these lifestyle medicine behavioural techniques and using that behavioural science, we can think about, goal setting, motivational interviewing, which is an amazing thing to do with your patients, CBT, all about reframing. And many of us will have access to health coaches within our practices or within the NHS. And about group consultations as well, which is one of the things that Francis mentioned earlier, that if you are interested, do get in touch with the BSLM. We do have lots of support and work on our websites if you want to try and find out more about any of this. Next slide, please. And at BSLM, we've also delivered a lifestyle medicine screening questionnaire, which is on our website. So have a look at that. You might want to do it on yourself, and then you can develop some goal setting from there. Next slide, please. And this is something that I've actually done as part of coaching, where you can plot where you are within career and health and friends and family, and then do your intervention, and then a month later or so you might want to go back and see where you've progressed. It's a very visual way of seeing what you need help with. Next slide, please. And I think it's interesting to have a look, where you are on your own personal journey. Where are you in that stage of change? Have you decided what you need to do to help your own health and well-being? And are you within the pre-contemplation, contemplation, preparation? And it may be that you might want to come back to this in a few months, or it may be that you're ready to make that one change. Next slide, please. And so here are the 6 pillars of lifestyle medicine, and I'm just going to go through them very briefly in the context of us as healthcare professionals. Next slide, please. So I think, many of us are very busy. We're very tired when we get home in the evenings, probably, tired to cook. So it's all about preparation for us, and in healthcare settings, in hospitals, in GP surgeries, and many biscuits, chocolates, all of those things that people bring in as a treat. But we need to look at other ways of eating properly, eating healthily, avoiding that sugar rush and that sugar down spiral, and making sure we're drinking plenty. We often forget to look after ourselves with hydration. So all the things that I'm sure but it's sometimes really helpful to have that reminder. Fruit bowls in the staff room, any of those kind of things. But it's really important for us because we are at that stage where we I know I do, just pick at the nearest thing because I haven't had time to get any lunch. So next slide, please. And physical activity, how can you incorporate that? Will you take the stairs? If you're doing your prescriptions or your blood results or something along those lines, can you do squats after 10 EPS? Can you bring something in? Can you go out for a walk at lunchtime if you have the time? Can you walk to work? Lots of different changes, and maybe if you're doing it as a collective in a group of your colleagues, you're more likely to do it. Next slide, please. And not forgetting, if you are, going through menopause or in the older age group, you might want to think about balance and also strength training. I think that's really important. Next slide, please. Sitting down, we want to be standing up if we can. We want to be moving once an hour. Doing different things, like rather than calling your patients, you might want to keep going backwards and forwards to the waiting room. So there's lots of little changes that you can do in your day to help. Next slide, please. And I think, just on a serious note, that as healthcare professionals, we do have a higher rate of suicide than other professionals. So we really need to support each other and look out for the signs of burnout with your colleagues, help and support. Let's have a non-judgmental, open culture where we talk about things. And if there's any way of looking at mindfulness or talking about it in your team meetings and offering support and discussing lifestyle, yoga, we've got something about that later. In my practice, we're going to start mindfulness, or even things like having a table tennis, one of those nets that you can play table tennis with in your breaks. We've got something like that in my practice. After this, we'll be showing you a video of NHS practitioner health, which looks at mental health support for our healthcare workers and members of our NHS. Next slide, please. And healthy relationships. This is Alex Maxwell, who's our president at the BSLM. Why not? At my practice, we used to have a netball team where we'd all go off and play on a Monday evening at the local park. So there are lots of things if we get people together. So much joy that it brings. So don't forget about those social connection opportunities. And many of us will be doing shift work, and I realise this is really difficult. Make sure you get early morning light, have a big breakfast at the time you're supposed to be having breakfast to reset your clock. And if you're not doing shifts, try and sleep at the same time every day and wake up at the same time every day to keep that circadian rhythm in place. Next slide, please. We also, as healthcare workers, have a higher addiction rate of, drugs, alcohol, all of that. So be mindful of that and get help if you need it, and support with all the lifestyle factors and behavioural change techniques. Next slide, please. And this is a little bit about epigenetics and how green spaces can actually lengthen the telomeres, which help to protect us. So I think that's really important to get out in nature and green spaces as well. Next slide, please. And engage with whichever activities that you can. But I think the important thing is to bring joy to what you're doing. Next slide, please. And that's just a little reminder that lifestyle medicine is for us too. So I hope you enjoy the day. I'm going to pass back to my colleagues now to show you that video from NHS Practitioner Health. And there will also be something at the end, which is from Doctors in Distress, which will be a video for you to watch in your own time. It's a bit long to fit into the day, but I hope that's really helpful for you as well. Thank you.
I'm here today to tell you about NHS Practitioner Health. My name is Lucy Warner, and I'm the Chief Executive with the service. And what I want to do today is tell you a little bit about what we do, who we see, and how you might access the service if you need it, or if a friend or colleague does. So, Practitioner Health. We are a free and confidential NHS treatment service. Our target audience is health and care professionals who are working in health in NHS or care services, and who are either looking to return to practice or are suffering with mental health and or addiction problems. The service is available as a self-referral service, and that's available to any doctor or dentist in England, or any member of the workforce who may be facing a barrier to accessing confidential care. The service was established back in 2008 and we're commissioned through NHS England. We've seen around 30,000 patients since we launched, and during that time, the majority of the patients coming through have been medics. But we also see a small proportion of nurses and other health professionals. As I've said, anybody working in health or care services in England is able to access Practitioner Health as long as you meet our eligibility criteria. And put very simply, that is, you must face a barrier to accessing confidential care. And that may be because of the role that you're in, a professional role, a leadership role, or simply working in mental health services yourself. Or you may be involved in a complaint or an investigation that's going to impact on your professional registration, where we can provide some additional expertise. So, Practitioner Health is a specialist service. But when I say that, I don't mean that we're a specialist mental health service. Our specialism is in understanding the crossover between our individual patient as a professional who needs to ensure that the regulatory environment or the professional environment in which they work is a safe space for the patients who access that service. So they may have responsibility for taking care of patient safety. And our role is understanding the responsibilities that that places on the patient in front of us and managing those risks appropriately. So we have expertise, understanding and experience in how health professionals present for treatment and the issues that they might face when doing so. And in particular, we have expertise in dealing with patients who are working their way through complaints or investigations, because what we do know is that can be a particularly worrying and distressing time for people. And we see that as a red flag for suicide. And our key role here would be to support those individuals whilst they go through those processes and ensuring that wherever possible, they can return to safe, effective practice. So what sorts of things can we do in practitioner health? I'll talk you a little bit through the patient journey in a moment or two, but very simply, what we're providing in our service is an assessment followed by a range of options to consider treatment and therapy within the service. So one of the most important options might simply be the relationship that you build with your lead clinician, who will be offering case management and ongoing support throughout your clinical pathway. We can also offer prescribing, and our clinician may start you on medication as an initial approach to dealing with your care. We have a range of therapy offers, both at individual and at group level. Some of those group offers are peer support, offering facilitated psychotherapeutic support, with others who are facing the same sorts of challenges as you may be. For those who are dealing with alcohol or drug misuse, we have 3 options for inpatient detox and rehab. So 3 centres where we can get people admitted and provide a 6-week pathway through treatment. And then importantly, where it's going to be helpful, and usually with the consent of our patients, we can also liaise with regulators, occupational health and employers to ensure that people can stay in work safely, or where they're looking to return to work, that they can do so with any appropriate adjustments that are needed. And that may simply be talking to occupational health about arranging regular time off to attend therapy appointments, or for people who are returning to work, thinking about what the triggers to their mental health were in the first place and any adjustments that need to be made to ensure that they can stay well in the workplace. So in terms of numbers, you'll see here from the slides that our numbers shot up quite considerably during the first year of the pandemic. Now, this was the time when we started taking on non-medical professionals, but nonetheless, the vast majority of this increase relates to medics. Our service currently sees 90% medics and around 10% of the other professions coming through. So for the last 3 years, the numbers have been relatively steady at around 6,500 patients per year. And the reason people are coming, the vast majority are coming with what we would call common mental health conditions. So that may be with anxiety, depression, stress, burnout type symptoms, or simply feeling overwhelmed and unable to switch off. We also see people with quite significant mental health conditions such as bipolar disorder, and of course a small proportion, as I've mentioned, with drug misuse or alcohol misuse. So how does the service work? A patient will fill in a self-registration form on our website. It's a relatively long form, and we don't apologise for that because there is an awful lot of information that we can gather that helps us make a judgment and work out the best way to support our patients. But once that initial web registration has been completed, our first contact team will review that and will usually be booking an initial call with you, usually by telephone, to discuss how we might support you and what your expectations are of the service. In some cases, at that stage, they may be able to refer you direct to therapy, either individual or group, or in cases where your needs are greater than we can offer, our team of psychiatrists will be supporting you to get referral into secondary care, if that's appropriate to do so. In all other cases, you'll be booked in for an in-depth assessment with one of our clinicians, and that is an important starting point of your journey to treatment. That initial assessment is usually expected to be something in the region of 60 minutes, even up to 90 minutes long, and will be an opportunity really to hear your story, to tell us about what's been going on in your personal and professional lives and how we might be able to help. And then together with your clinician, you'll develop a care treatment plan and work out the next steps. And again, that could be a referral to therapy. It could be starting on medication, as I've mentioned, or it could be thinking about which other additional services might be helpful to you. To ensure consistency, all of our cases are then discussed at one of our national MDTs. We have almost 100 clinicians working up and down the country, and so it's really important that they individually have support with their decision making, and that we can provide some peer support for them, that they can call on expertise within the organisation, and that we can ensure that the service is offering a consistent approach to care whilst always taking into mind the needs of the individual patient. One of the outcomes might be from all of that you're identified as needing further specialist assessment or treatment. And again, we will support that referral either to secondary care where appropriate, or if that's for inpatient detox and rehab, through one of our own 3 centres that we use. And then finally, with all going well, hopefully you will be supported to discharge. We see really good recovery rates at about 6 months in many of our patients, and the majority of patients are with us no longer than 12 months. So just a little bit more about how the service operates and what you can expect. We recognise that for health professionals, you are working in environments where you don't always know your clinic rotas or your working rotas well in advance. And so giving you control over when your appointments take place, the date and the time, is particularly important. We also know that the world of NHS is a very small one. Many of us know each other, many of us train together, many of us work together in different scenarios across the years. And so it's equally important that you, as a patient, have the opportunity to select the clinician or therapist that you're going to see, and to identify that that isn't somebody you already know. So our booking platform enables our patients to select their own clinician, their own therapist, whether that be in area, out of area. So, for example, somebody who's working up in Nottingham may decide to select a clinician who's based down in Norfolk, just to ensure that additional level of confidentiality. And that booking platform will also enable patients to reschedule appointments if they're asked to work at short notice, and our clinicians and therapists can send through wellbeing questionnaires to patients using that booking platform. So repeating those questionnaires that are done at registration that enable us to identify the progress that's been made on the journey to recovery. And in terms of outcomes and in terms of recovery, our patients do get really well and they stay well. When we measure at registration, the vast majority of our patients fall into what we would describe as caseness for either anxiety and or depression. And 94% of those patients have achieved recovery by the time they're discharged from our service. Additionally, of those who aren't in work at the time that they come to us, 84% of those patients do return to work or to training by the time they discharge from the service. And importantly, for those small proportion who come to us with alcohol or drug misuse issues and who wanting to achieve abstinence, our long-term abstinence rates are in excess of 80%, and that compares to 20 to 30% in community services treating the general public. And in terms of impact, our patients report on self-reported measures really positive outcomes. So 94% of our patients would recommend the service to their friends and family, and 93% believe the service is confidential or very confidential. But more importantly, they believe the service has had really positive impacts either on their well-being or on their personal and family life or on their ability to keep working and training. And vitally, for those who had thought about leaving the service prior to accessing practitioner health, 78% believe the service has had a positive or very positive impact on their intention to keep working. And we achieve amazing feedback, really heartwarming feedback from our patients. And it's an absolute honour to work in a service where we receive this kind of messages from our patients on an almost daily basis. So finally, I just want to say, if you or somebody you know is struggling with your mental health and feel that you would benefit from a service like Practitioner Health, and you're unable to access services through local mainstream routes because you face that barrier, then you can go to our website, that's practitionerhealth.nhs.uk, and our website registration forms are there on the first page for you to click and complete. If you want to talk to us, our telephone number is there, or our email, and our telephone lines are open between 8 and 8 Monday to Friday and 8 till 2 on a Saturday. If you are in crisis and you think you need help sooner, we do operate through Shout, a text crisis service, and you can access help in that way. Please, if you've listened to this message and you're thinking that you or someone you know might need help in the future, take a snapshot of this screen and save it on your phone for future use. Thank you. Stop.
Just to say that Rupa can't take questions live today, so if you do have questions, please pop them into the Q&A chat box on the site here. Thank you. And next, I'll introduce you to Dr. Kate Woolley, who is our Learning Academy Director and is going to talk to you about the Learning Academy and how it can help you in your work.
Hello everybody, I'm Kate Woolley and I'm the Clinical Director of the BSLM Learning Academy. I'm just going to share my screen. Thank you for attending this workforce study day today. I'm here to talk to you about how the LMCA supports you as an individual before your patients. I'm just going to start the slideshow now. So I'll talk about why this topic's important, why we've included it within the LMCA specifically as a topic, but also more widely how the qualification can support you, and think about it from a few different angles, really. So why have we included this topic in LMCA? I'm sure from the sessions you've seen so far today that you are well convinced of how important it is to look after our well-being as healthcare professionals, and probably that's a big reason for why you signed up for this day in the first place. We've got to put our own oxygen mask on first. I'm sure I won't be the only person to say this today, and essentially if we're not looking after ourselves, we can't look after our patients very well. So looking after our own well-being is critical anyway, just for us as individuals, but also for patient care. I'm going to present a little bit of data now about the state of workplace well-being in the NHS. Unfortunately, it's not very good at the moment. So this is some data from the NHS Staff Survey 2021 and also from the King's Fund. Unfortunately, NHS staff are 50% more likely to experience work-related stress or high levels of work-related stress compared to the population in general. And nearly a third have experienced musculoskeletal problems in the last year because of work-related activities. Nearly half felt unwell because of work-related stress in the last year, but despite that, people are still going into work despite not feeling well enough to perform their duties, and nearly a third feel burnt out because of their work. This is information then pertaining specifically to doctors from the GMC 2019 review. So nearly half of doctors in hospitals and other secondary care organisations are considering leaving the organisations in which they work, and actually nearly a fifth are thinking about leaving the NHS altogether. This is due to stress and low workplace wellbeing. GPs reporting the lowest levels of job satisfaction in many years, and in 2017, in their survey, more than a third were intending to quit direct patient care. I've really noticed, I'm a GP myself, I've really noticed a move towards portfolio working and sort of not necessarily providing direct patient care because people find it too difficult on the front line, too emotionally draining. I know that one of the reasons that some people take core accreditation is because they want to move away from NHS direct work, although that doesn't have to be what happens. We've very much set up core accreditation as something that can complement your NHS practice and that you can use within your NHS practice. And I'll say a bit more about that later on. But it's something that some people are thinking about as an alternative as well, and thinking about different ways to use it, so diversifying their skill set and future-proofing themselves. More than 30% of doctors in secondary care have reported being unwell because of work-related stress, and 1 in 4 doctors feel burnt out to a high degree because of their work. So some really stark statistics here to show us that this is a really big problem and one that we need to be taking notice of and taking positive action on. So that's the really depressing data about staff burnout. I also wanted to say a bit more positively, even if you're not burnt out and at the end of your tether with clinical work, and you're thriving in clinical work even, the impact of your lifestyle habits do still impact your patients. If you're somebody who's interested in trying to make a difference to patients' lifestyles, then demonstrating those lifestyle habits yourself is going to make the quality of your advice much better. You're going to be more likely to give advice, and patients are more likely to see you as a credible role model. So this is a 2016 literature synthesis of 47 articles about the association between healthcare professionals and personal physical activity habits and their physical activity counselling practices. And they found consistent support that physicians who are active themselves are more likely to provide counselling to their patients and can become powerful role models. We've all heard of the concept of park run practices, I imagine, or certainly those of us working in primary care have. So that's where a GP practice forms an alliance with Park Run, and members of the practice staff go to the park run locally each week, and that can be where they serve as a role model and support patients in getting active. So these sorts of initiatives are being seen a lot, which is brilliant. This graph that I'm showing you here is just 6 of the papers that were directly comparable, where you can see the odds ratio of the frequency of counselling and in their attitudes towards counselling, and you can see that it was consistently improved, so above 1 when physicians were active themselves. That's all apart from the 1 second from the left, which is approaching the significance level. So that's certainly not a negative effect, but it's less significant. But see it across the board, positive effects being seen. So this study looked at smoking. So it was a large questionnaire study in Canada, asking physicians about their smoking habits and also about their likelihood of counselling patients on smoking and the quality of that advice in various domains. So what you can see is that physicians that were current smokers were much less likely to counsel on stopping smoking. than people who had never smoked. Interestingly, former smokers were more likely to provide adjunct support. So there's maybe something there about having been through the change themselves, or been through the lifestyle change themselves, that made them give sort of maybe even higher quality support, because they maybe had more of a idea of what was necessary. So, and I hope that this kind of situation is reflected across where we're giving advice. So active lifestyle change ourselves can improve the quality of the support that we're able to give patients, because we've been through that process ourselves. And this finally is the Women's Physician Health Study, which was a questionnaire study of over 4,000 respondents in the US. So they asked about eating habits and nutritional counselling, and found that so this is just female physicians, those who were regularly performing nutrition and weight counselling were more likely to be, those who are conforming, who are following a healthy diet and managing their own weight, are much more likely to counsel patients about nutrition and weight. And this extended also to more generalised self-reported prevention behaviours, so cardiometabolic disease prevention behaviours, so all of the sort of lifestyle behaviours we talk about in lifestyle medicine. Practicing the behaviours yourself made it much more likely that you would talk about it and provide high quality advice. So that's, even if we're not talking about burnout, we can do much better in our lifestyle medicine practice if we're practicing what we preach. So how can, and so that, just in summary, that is why we feel that it's really important to include this topic within LMCA and support our LMCA learners to change their own lifestyles, as well as supporting their patients. So how can the lifestyle medicine core accreditation help with this? And we'll look at a few different ways, really. And we all know the 6 pillars of lifestyle medicine. I'm sure they've been mentioned already today, but learning something new can improve our mental well-being directly. This is because of increased confidence and self-esteem from the new learning. I've experienced this personally as a GP, having studied lifestyle medicine over the last 5 years. Before I studied lifestyle medicine, I knew that I felt I had an important role as a GP in supporting patients with lifestyle, but sometimes I felt that the questions they wanted answering were beyond the limits of my knowledge, and I felt that I wasn't necessarily giving the best help that I could. I remember one person with type 2 diabetes asking, saying to me, what should I be eating? Because, people say sugar's bad, people say fat is bad. And what I'm finding is that if something doesn't have a lot of sugar in it, it usually has a lot of fat, and vice versa. And how can I kind of resolve that and to make the right food choices? And, I did give him an answer, but I felt really unsatisfied with it. And I felt that I could know more about this and give a better quality answer. And I'm happy to say that now, having studied lifestyle medicine, I feel like I could field that question and really help him and give him some tangible advice that he can action to, because these people actually want to improve their diet, so it's really nice to be able to engage with them. Similarly, it never sits well with me if I'm prescribing sleeping tablets or pain medication for sort of chronic pain. Obviously, when it's necessary, then I will do it, but I always found it really difficult when I was saying no to these medication requests. When the patient's sitting in front of me, they're asking for help, and their solution, for example, to their insomnia is that they want some sleeping tablets. But being able to have that conversation that's not simply a no, I'm not prescribing them conversation, but actually, I think I can help you in a better way, explaining why I don't think it's a good idea to prescribe the sleeping tablets, and be able to really listen to them, go through their lifestyle in depth with them, and identify some things that they can change in their lifestyle that they might not have thought of. And then they leave that consultation not feeling like their request has been denied, but with real hope that they might actually be able to make a difference. That actually happened to me just yesterday in my day as a GP, where a young person came to me who'd been suffering with insomnia, and they had thought of sleeping tablets, but together we were able to think of a lot more strategies that they could action. And I hope that will lead to a much better long-term prognosis for that young person. So I do feel much more confident in practicing the way I want to practice in medicine. Increasing your sense of purpose as well. So within the mental wellbeing pillar of the core accreditation, you will learn all about the positive psychology and the role of a sense of purpose in improving our well-being, and studying something like the LMCA can improve our sense of purpose in our work. And then, of course, there's connection with others, another of the lifestyle medicine pillars. So we try and support you during LMCA to make as much of a network with other learners as possible. So everyone studying the LMCA will attend conference during their LMCA studies. And that's really for expanding your network, meeting like-minded lifestyle medicine healthcare professionals. And during conference, we usually get an event together for just the learners so that everyone can meet each other. Aside from conference attendance, we do also have 3 monthly learner check-ins where we all get together on Zoom with myself, and I can take any questions you might have about your studies. But then also we have breakout rooms for people at different stages of the course to meet each other, share how they're finding it and what strategies they're using to study, and have a bit of a chat about where they are. Often off the back of that, people are forming study groups, and if you're not able to attend that learner check-in, we can support you separately to form study groups as well, just to sort of take you through your studies and kind of keep up that momentum, have people, somebody to bounce the concepts off that you might be learning, talk about how you might be putting them into practice. I studied with BSLM quite some time ago now, as I said, but my study group I'm still in contact with. We meet up at conference each year, and we meet up on a semi-regular basis to just share our lifestyle medicine learning and experience. We've kind of morphed into something of a book club, and it's a really, a really beneficial thing in my life, beyond, in supporting my lifestyle medicine practice, but just generally in terms of my social connection. So the LMCA can help with that as well. I'll just say a quick thing now about the LMCA structure for anyone who's not familiar with it. So this sort of is a diagram depicting it. Essentially, it's a course in 3 stages. You start with the foundations of lifestyle medicine, where you get introduced to what lifestyle medicine is and why it's important. Then in the second stage, we move on to studying each of the 6 pillars in depth. And then, having really digested that information about what lifestyle medicine is, why it's important, what the 6 pillars are and what they consist of, then the final stage of the course focuses on putting it into practice, delivering lifestyle medicine and developing those skills that you can use to practice lifestyle medicine. So things like social prescribing, health coaching, some CBT skills, group consultations, approaches. So all the of ways that you might think about putting lifestyle medicine into practice. We'll cover kind of the basics of those things so that you can think about how you're going to actually deliver lifestyle medicine. And then woven through that is our program of continuous assessment. And we've done that purposefully to sort of help you build up your learning in layers. And we've arranged it so you can take your assessments whenever is right for you. So when you sign up for core accreditation, you've got 30 months to complete all of your learning. So a really long time, given that the average kind of completion time is 9 months. That's you've got lots of extra time. So if life happens, you have to take a break, things go a bit slower for a while, that's absolutely fine. Essentially, you can submit your assignments whenever you're ready and move on to the next stage of the course. And that's so that you don't have to be working to anybody else's timelines, and you can take it at the pace you want to. So you might, for example, if it's winter and work is really busy, then you might not study at all over winter, and then you might have 2 weeks off over it, in May, where you want to really get through cover a lot of ground, and you might get through 2 sections at once in that time. And you can, so it's really flexible around what you want. And that's another way that we try and look after your well-being whilst doing core accreditation, is by allowing you to flex it around your life. So I've sort of alluded to this, but learning all about the principles or the pillars of lifestyle medicine allows you to apply them to your own life. So you've probably seen these already today, but here they are on one slide. So mental well-being, I've talked about how the LMCA enhances that in general, but you will have your dedicated mental well-being course within the pillars section, where you'll learn mindfulness techniques, positive psychology techniques, amongst others, to try and improve mental well-being. And these are things you can teach your patients, but also use yourself. Again, advice or information around minimising harmful substances. So if this applies to you, there's a change you want to make, then you'll get lots of practical information about how to make that change that you can pass on to your patients or use yourself. Healthy relationships is really important. I've discussed how the LMCA more broadly can support having healthy relationships in your life, but through your study of the LMCA, you'll learn about how to support people, patients and yourself in improving quality of relationships. Nutrition's a really important one. It's, as I mentioned, a topic that I was less confident in before studying lifestyle medicine, but really now I feel really able to give that quality advice and make dietary choices myself that I feel reflect my dietary goals. And more importantly, I've got young kids and able to support my family in eating in a way that I feel reflects the dietary goals that I have. And through the knowledge that I've gained through studying lifestyle medicine, I'm able to implement that in my own life. And there's not one dietary pattern that will be right for everybody. And so we've taken what we call a diet agnostic approach to the LMCA, where we present lots of different types of eating patterns and discuss the benefits of them, so you can make the choices that are right for you. Sleep, I've said already how I use that information with my patients, but very much I use that myself as well. So trying to maintain, I know myself that if I'm not getting good quality sleep, then I'm much less likely to feel good in life and be able to achieve the things I want to achieve and just generally feel good. So I very much put into action all of the lifestyle medicine points that I've learned from my lifestyle medicine study, and that's something you can do as well. And people often are attracted to lifestyle medicine because they might have some sort of difficulty with one of these areas themselves, and they're interested in further study, and sleep is no exception to that. We also support you through the core accreditation in choosing ways to incorporate more physical activity into your life. You'll learn all about the different kinds of physical activity, and how to get physical activity into your life in different ways, not just spending ages at the gym, and also, including both strength training and cardiovascular exercise, and also stretching and flexibility. So all the different kinds of exercise or physical activity that you might need to have a balanced program. We've got also, aside from the pillars that you can apply directly to yourself, we do have a module in the core accreditation specifically to practitioner health, all about recognising burnout in yourself and assessing your own lifestyle medicine needs and creating a personal health action plan. So that's in the skills section, because we kind of look at care of yourself as a healthcare professional as one of the skills that you need to practice lifestyle medicine. And so we've got that dedicated support as well. Just another angle really to think about it now is that we do, as you will have probably seen the LMCA physician version and healthcare professional version, and maybe some of you will be enrolled on that. We also have a version for non-clinical professionals that's going to be coming in the next few months. So that might be for care coordinators, health and wellbeing coaches in the NHS context, social prescribers as well. All of these people won't necessarily be giving direct health advice, but they very much could benefit from background lifestyle medicine knowledge to help frame the conversations they're having. Likewise, we have the overview course, which is just 1 hour. So that would be useful for reception staff, just so everybody in the practice can be kind of singing from the same hymn sheet and understand what we mean and what we're trying to achieve. And we're seeing practices and PCNs turning that inwards as well. So not just using the multi-professional learning that BSLM offers to set up programs for patients, but also to change how they're operating within the practice and making sure that their practice is a healthy place to work. So that might be, the part one practice that I mentioned might be about kind of policies around what types of new food you have for practice learning events, but just bringing those lifestyle medicine principles into your practice can be really important. So in summary, I hope that I've outlined how the LMCA can bring benefits for you as a healthcare practitioner, for your patients, and also benefits for your colleagues. Thank you very much for listening, and I'm pleased to take any questions that you might have.
Thanks very much, Kate. That was really comprehensive run through of our Learning Academy output, and thank you and to your predecessor Ellen for all the work that you've put into making it such an important go-to place for learning for health and care professionals. So, as Kate has said, happy to take questions. It'd be great if you could put them in the chat. And we have a first one there from Sita. So, Kate, how did you get into teaching at the University of Leicester?
So I, as well as my role with BSLM, I also work as a research fellow at the University of Leicester. So, and obviously you talk to people in your department, and my research is in the field of lifestyle medicine as well. So talking, it's quite kind of common that if you're a clinician who's doing research, you might be asked to have a role within the course. And once everybody knew that my interest was lifestyle medicine, people were really interested in that. We're really lucky at Leicester University that we've got a lifestyle medicine course incorporated within the first year of medical study. So it fitted really well. And so I started firstly as a course tutor with them. And if you're local to Leicester and you want to reach out to me privately, and I can put you in touch with the people who run that lifestyle medicine course if that's of an interest for you. So that was small group teaching that I initially started with. But then later, one of the lecturers who was lecturing on nutrition moved on, and I was approached to see if I wanted to give the nutrition lecture. So yeah, that's how I got there.
Thanks for that. And can I just ask everybody, if possible, to put questions into the Q&A tab? Kate, we've got a question there about Dr. Rangan Chatterjee, if the PLM certificate via Unbound Medicine is an accredited course. I can't give you the answer to that, so.
So I'm not sure who you mean accredited by. I think there is a portion of Dr. Rangan's course that's accredited by BSLM, but it's not the certificate. I think the certificate was something that's added later that's not been accredited by us, but it's a completely separate course to what we offer. So I'm not really able to advise too much on that.
BSLM course is much more comprehensive in terms of its attention to all of the pillars, all of our 6 pillars.
Yeah, I didn't want to go too much into it because I don't think it's my place to criticize somebody else's course either. But of course, I feel that definitely our course is more comprehensive.
Any other questions? If they don't immediately come into your head, please feel free to type them into the chat box in the Q&A section as we go through the day.
And just on the question about practicing lifestyle medicine, so I guess it has been a useful place for some people to start. Lots of people know about Rangan Chatterjee, and so they come in that way. So we're really grateful for him raising the profile of lifestyle medicine, and sometimes people will then proceed to core accreditation afterwards because they might have done a smaller course and then decide that they want to do more in-depth study with us. We've also recently launched our own introductory course as well, which is a much smaller course than the core accreditation for people who just want to start off their learning. And that for our introductory course, if you do complete that, you're fees paid and your learning within that course is then redeemable against core accreditation if you decide to proceed down that route in the future.
There's another question from Katrina, Kate, about she's non-clinical, she works in population health, and she's asking about an offer available for those who are not clinical.
Yeah, so we very much appreciate that the knowledge contained within core accreditation has much wider applicability than for healthcare staff only. There's a challenge for people who are not clinical people and maybe or haven't had training in clinical practice, that we don't provide, we don't qualify you as a type of healthcare professional. So we can't allow someone who's not a healthcare professional or doctor onto our core accreditation course. But what we do have for people who could use that knowledge is the enhanced professional development version of core accreditation. So it contains very, very similar knowledge, but without the assessment package as an automatic thing. You can purchase the assessment package if you want that as a learning tool, because that can be really helpful just to consolidate your learning, but you'd come out of that with all of the same knowledge, but just wouldn't be regarded as a lifestyle medicine practitioner if you're not a currently practicing healthcare professional.
That's great. Thank you very much. Okay. All the questions that I've seen in the Q&A chat, Kate, so can I thank you very much? And we're now going to have a short break. Sorry?
I spotted a couple that have come into the Q&A. Do you want me to answer those, or do we need to go?
Yeah, sure. Go on.
So someone's asked, after doing LMCA, can we call ourselves lifestyle medicine physicians? That depends on if you are a physician to begin with. If you're a medically qualified individual, then you can call yourself a lifestyle medicine physician. Afterwards, if you're a healthcare practitioner, then you'll be a lifestyle medicine practitioner. If you're going for that enhanced professional development version that I mentioned, because you're not directly a healthcare practitioner already, then it's more that you are whatever you were before you took the course, but with enhanced skills in lifestyle medicine or enhanced knowledge in lifestyle medicine. And then Dr. Mehta's asked if we have to attend the conference in person to gain the qualification. That's right, because it's just 3 days in the whole of your 30-month registration. So there's a couple of opportunities over the whole time you're registered to attend it. And we consider that a really important part of your learning for the things that I said in my talk about making your network and kind of connecting with other people and digesting the content. And in very, very select circumstances, there may be ways around that, but in the main, it is face-to-face. I think the main thing is if you're not based in the UK, then we don't expect you to fly over for the conference in person. But we are exploring other options for courses to attend, but the conference is very much the gold standard.
Thank you. So we'll have our short break now. Thank you, Kate. That's really helpful and good to have all the answers that you've provided as well. So remember to get up, move around, make sure you have some water, keep hydrated, and we will see you back at 11:50. Thank you. I hope everybody's come back to join us for our next session. It's my pleasure to introduce Dr. Kath Jones, who'll be talking about prescribing whole person care to heal our future NHS, which is a pretty tall order, Kath, but we're with you on this journey. So please carry on.
So thanks to BSLM for this opportunity. I'm a GP in the Scottish Highlands, and I'm also the founder of Wildness Health, which runs educational events for health professionals, inspired really by the experience that I'm going to share with you today. So yeah, I'm going to share a little bit about the context I'm working in, so you have an understanding of where I'm talking from. Some of the things that have shown up for me during the experience that I'm going to describe. Really some practical tips that I found work really well for me in consultation in terms of integrating a lifestyle medicine approach into my NHS role, and how that's felt for me and people around me. So this is where I'm based. If you look at the map on the right, I'm very far north, about half an hour north of Inverness. So pretty remote, half an hour from an emergency department. And this is the practice I work in. It's Ornest and Invergordon. So if you look on the right, this is Index of Multiple Deprivation in Scotland. And on the far left is the district that I'm working in. So a quarter of the households in my practice area, where 13,500 patients live, are in most deprived, have the highest levels of deprivation in Scotland. And that's really what kind of drew me to lifestyle medicine, was this concept of shifting power, particularly to people that have low levels of power, and how we can work in a way that's more effective for our patients, but also much more healthy for us. And I think it was really interesting to listen to the previous presentations, which kind of set the scene about some of the challenges we're facing. And I think particularly Kate's presentation, 3 words stood out for me, which was listening, hope, and books. So hopefully I'll describe a bit about what I mean by that in this talk. And really, I guess what I'm trying to get across is that I think by integrating this approach in our work, we are much less likely to lead the services of practitioner health, by being mindful about how we're practicing. So the area I work in, this is from an interview with Luke Stoltman, who's the strongest man in the world, or was, I don't know if he still is. So this is from just under 3 years ago. And we have a lot of papers in Highland, and they like writing about health stories, particularly bad news stories about health. So the practice that I now work in was in a pretty bad place 2.5 years ago. Luke felt it had hit rock bottom. But the bit I really want to draw your attention to is the bottom paragraph. And one of the really unique things about this community that I'm working in that I think has made this approach particularly effective is the kind of spirit, the community spirit. And he talks about wanting to make the practice one of the best in Scotland, a shining beacon. And it's not just the NHS that can do that, it's all of us. And that is a kind of attitude that I found to be really prevalent throughout the whole community and has made it a really rewarding place to work. So these are 3 questions that have kind of repeatedly come up for me during thinking about all of this. My first proper introduction to British Society of Lifestyle Medicine was the conference in the Tottenham Hotspur Stadium, so just over 3 years ago, and totally blown away by a kind of energy, enthusiasm, but never seen such a happy, healthy looking bunch of health professionals in my life. And so that kind of drew me into all of this, did my accreditation shortly after that. And it's really got me curious about these kind of issues, really. So I think the pivotal thing for me is what actually is health. And we talk a lot as health professionals about getting to the root cause of our patients' symptoms. But I think thinking about what health is can help us get to the root cause of what's actually happening in the NHS just now. Because I think a lot of us realise that it's not working that well at the moment for many of us, both as health professionals and as patients. And that led me on to thinking about what my role was as a GP and what else is possible. So if we think about what health is, we've got our WHO definition. I think those of you who were in Manchester at the conference might have heard Phil Hammond do an amazing talk about what is health. And that kind of got me really thinking about this subject, and also reading more about this concept of salutogenic model of health. So the WHO definition of health as a complete sense of well-being, not just the absence of disease and infirmity, really describes a kind of pathogenic approach where we're trying to eliminate pain and illness. But there's also another way of thinking about things, which is a salutogenic approach where we're trying to create health. And I think a lot of the models that come under this salutogenic model of health, like coaching, motivational interviewing, these kind of tools are very much sort of the bread and butter of lifestyle medicine, and have really helped me to practice in a way that I felt has worked much better for me and much better for my patients. So just really something to be aware of, that the way we define health is actually a social construct. You know, it's something that we're creating, and it is within our control as health professionals to change the way we think about that. So what is my role as GP? If you know, I came across the drama triangle and the empowerment dynamic when I trained as a coach, just before I did my accreditation for lifestyle medicine. That was a kind of my introduction. I was an associate medical director for a couple of years, and pretty much burnt out doing that and had some coaching as part of kind of recovering from that. And I found it so powerful that it inspired me to train as a coach. And these two concepts are so helpful, I think. And I think the drama triangle can be our kind of the status quo in terms of how we deliver healthcare. So we've heard about the kind of tsunami of conditions caused by exacerbated by lifestyle, but a conventional approach can still be us as health professionals doing stuff to the patient that should be doing to themselves. So, for example, the number of drugs that we might give to someone with type 2 diabetes, rather than working in a way that enables that person to take responsibility for their health and well-being. So I think on the right, the empowerment dynamic is much more in keeping with kind of lifestyle medicine approach, where we shift from being the rescuer to being the coach, where we really help the person try and have a breakthrough and have new thinking about the root cause of their symptoms, that encourages them to shift from the victim role, where they feel helpless and hopeless, to a creator role, where they start taking radical responsibility for their health. And I think a lot of the problems that I'm an appraiser as well, and a lot of the problems that I hear people talking about relate to quite unhealthy relationships in the workplace, either with colleagues or patients. And you start to recognize, if you look about the drama triangle, this is a very unstable dynamic and people flip roles quite frequently. And you can start to see how that's playing out. I think that frustration that we're trying to use a model that's well out of date worked well for infections and injuries, but does not work well for lifestyle related conditions. And I think that creates a kind of dysfunction in the NHS that reverberates around between health professionals and into people's personal lives and plays out in the fact that we heard that 90% of people seeking help from practitioner services are doctors doesn't surprise me. So I think, this empowerment dynamic, which lifestyle medicine as a framework enables us to shift into the empowerment dynamic, for me has been a really amazing experience. But what else is possible? So, it's sometimes you can feel like, okay, well, I can do my accreditation in lifestyle medicine, then what? And I think this Stephen Covey, it's called Circle of Control, can be really, really helpful to think about that. So not only the things that we can do to change the way we practice, but what can we actually influence around us, and what actually is outside our influence, maybe a concern, who's in government or the latest health policy. How can we park that to one side and focus our efforts and our energy in what we can control and what we can influence, and trying to encourage our patients to do the same, I think can be really helpful. And again, is very in keeping with kind of how I interpret the philosophy of lifestyle medicine. So what does that actually mean in consultation? Well, I've kind of developed this little framework for myself through 2 years really of trying out different approaches. And one of the advantages of taking a job in a practice, so the thing I forgot to mention at the earlier slide was, at that time, that headline about the practice was in a period of 2 years with no permanent doctors. So it's a practice of 13,500 patients in an area of high health need, with remoteness as a challenge as well. And the GMS partnership collapsed, and it was a revolving door of locums for 2 years. And that was the point when I joined the practice as a locum. So the advantage of being the first doctor to take a job 18 months ago is you have a strong negotiating position. And so I was able to negotiate, having done my accreditation in lifestyle medicine, to have half an hour with people with the most complex problems as a first appointment, and to start developing a framework using what I learned from my coaching diploma and my accreditation in lifestyle medicine to try a different approach, should we say a whole person approach to care. And so this is the kind of little framework that I've developed that I'm going to share with you today. And at the bottom of each slide, I've put the organisation that had a resource that I found helpful. So I would encourage you to have a look at these, and it might provide you with some tools that would be helpful for you. So these are the kind of patients that I am now drawn to. Probably before I would have called them heart sinks. And now I find, that have the most amazing consultations with people. And I think that goes back to that drama triangle where you're shifting from fear, blame, and judgment to presence, connection, and acceptance. So the people who come in with the 2 sides of A4 of symptoms, or the people who just reverberate around the practice and no one knows what to do with them. People with what might be called medically unexplained symptoms like chronic pain and chronic fatigue. So the first thing that I've realized is quite helpful is this concept of self-awareness. And the Conscious Leadership Group, if you've not come across this stuff before, I've got some fantastic resources in relation to this, which really are framed around this drama triangle to empowerment dynamic. There's got a great video, I think it's called Locating Yourself. They've got loads of free resources which you can look at. And they talk about there being a line. And if you're above the line, you're open, curious, committed to learning. If you're below the line, you're closed, defensive, and committed to being right. And I think, unfortunately, our healthcare culture, well, as human beings, we're hardwired to be drawn below the line, you know, especially under threat. So our nervous system is wired to keep us alive over and above having a positive experience of life. But I think our culture of health, you know, is also encourages us as health professionals to feel we need to provide certainty and we need to be right and we need to appear competent and confident at all times and not share our vulnerability. And I personally don't think that's serving us well. And I think some of the figures we heard from, you know, in the 3 presentations this morning, 50% of people, I think it was, feel unwell in relation to their work. I mean, absolutely shocking figures for a service that's supposed to be creating health. So yeah, it encourage you to have a look at that video and another video to have, which talks about drama triangle to the empowerment dynamic and think about that, how that might be playing out in your role, in your life at home, at work, and with your patients. So shifting the dynamic. So when I get the people with the 2 sides of A4, one thing I found really, really helpful is the resources from the Association for the Treatment of Neuroplastic Symptoms. Probably not come across this word neuroplasticity that much until about 2 years ago. And this organization, which is set up by a couple of physicians in America, have developed these 12 questions, which help you work out as a health professional whether your patient's symptoms are likely to be structural or neuroplastic. And the 12 questions are things about adverse childhood experiences. Do your symptoms get worse with stress? Have they been present for more than 6 months? Has anyone found an explanation for your symptoms? Questions that I found to be very acceptable to the patients that I'm asking about this. And I understand from David Clark that helped develop this that 65,000 people have filled in this questionnaire on their website, and the average score is 8.6. And that plays out in my consultations. Anyone who scores 8 and above, this kind of concepts about neuroplasticity or a mind-body medicine approach, if you like, seems to be really, really effective. So that can help you shift from, right, we need to do 20 blood tests, 3 x-rays, and refer you to 4 specialties, to a shared decision-making consultation around, I think a mind-body medicine approach might help you. Would you like to try that in the first instance? And that's obviously with the caveat of looking at the symptoms through a biomedical lens. Are there any red flags, which mean you need to exclude cancer or cauda or whatever the presentation is? But it helps you create that pivot. And I think that's similar to the way that I found that the lifestyle medicine questionnaire, which was mentioned earlier, can also create that pivot that takes you from being the rescuer, where you're doing stuff to the patient, to the coach, where you're creating the conditions for them to have a breakthrough in thinking. So in people who score under 8, I will use the lifestyle medicine questionnaire to help people shift their focus to things they can control, like daily habits, rather than things they're concerned about, like what are the results going to be of the test? Am I going to get a diagnosis? How long am I going to have to wait for an appointment? So I think creating that shifting power from us as health professionals to patients is really the cornerstone of this approach. The third step is really helping people make sense of the symptoms. So I think the term medically unexplained symptoms, you know, we can't explain what's happening to you, we can't do anything for you, is such a unhelpful narrative. You know, there's no cure for ADHD. All these narratives that I think are so harmful. And helping people, you know, explaining neuroscience to patients in my practice area, where there's not high rates of literacy and educational attainment, people are really receptive. It's accessible, and it really helps them shift forwards. So this book that I've put about the Buddha's brain, it's very detailed. You won't want to give it to all your patients, but it's certainly helpful, I think, for us as health professionals to be aware of some of these concepts, and how neuroplasticity, when you're exposed to other childhood experiences, it impacts on the development of the nervous system, your emotional regulation. So it provides an explanation for symptoms and why the mind might then generate pain, fatigue, or emotional dysregulation, but it also holds the key to people overcoming those symptoms and challenges. So hope. So I mentioned before about Kate's talk and hope. So hope is really, really important. And if you're trying to squeeze this framework into a 15-minute consultation, at this point, you will need to send a link for the patient to watch these videos at home. For me, I have the luxury of half an hour, as I say, for about 5 of my appointments a week. And so I will watch these 12-minute videos from Living Proof within that consultation. So there's one on chronic fatigue and there's one on chronic pain. And nearly all patients cry when watching this. So you can pick up on cues, you can see where it's resonating with them. And it's really the story of 2 different women who have overcome these conditions, sometimes after spending a decade in bed with chronic fatigue, and how they use skills, to often books, actually, again, to be able to shift forward in their thinking and adopt a much more empowered approach, a much more creative approach, rather than a victim approach to taking radical responsibility for their health. So as I say, if you only have 15 minutes, you're probably going to need to text a link to the patient and hope they watch it. The advantage, if you can watch it within the consultation, is by the time the person goes out the room, they're so fired up. They've had someone listen to them, validate their symptoms, give an explanation, and then create hope. And they will then do anything that you ask them to do. And that's where prescribing homework comes in. So really shifting the work out of the consultation. And books are very, very helpful for that. So I know that most people who are interested in lifestyle medicine have a bit of a book problem, buying a lot of books, and then they get stacked up on the bookshelves and you can't read them all. But this book, if you're interested in having a new way to support people with chronic pain, this book is absolutely a must read or a must listen to on Audible. Patients can download it on Audible for free, as long as they remember to cancel their subscription after 30 days. In my practice area, we set up a community book group in combination with the local leisure facilities and the CIC, and we now have a book club that meet every 2 months and look at these books that help people shift forwards and get unstuck. This book, Alan Gordon, he's a director of the Pain Psychology Center in America. He's got lived experience of chronic pain. He's also a comedian, so the book is accessible and funny and full of stories that inspire hope in others. Non-sleep, deep rest, Andrew Huberman, that's a 10-minute guided meditation. Again, if the problem is emotional regulation, rather than watching a Living Proof film, if the person is open to it, I will get them to do this in the consulting room, either sitting or lying in the consulting room, to help them feel that shift. And people sometimes will say, God, I didn't realize that I, had control over my nervous system. I didn't realize I could feel like that. So again, you're instilling that hope, and then trying to use the kind of habits from Atomic Habits to help them work out how to embed that into their life. Concepts of science of safety, so anchor maps. So helping people understand about how a nervous system can feel relaxed, mobilized, immobilized, and this concept of neuroplasticity again, thinking about parts of your brain as a muscle, and when you exercise them, they get strong. So if you've got a super highway of anxiety, it's very easy to feel anxious, but that is a reversible process, and adopting new healthy habits can help you reverse that. So how does it actually, maybe I don't know whether this sounds strange or amazing or impossible. I can tell you that it is possible to do this in the NHS, and this is some of the feedback that we've been receiving. So this was August 2024, so just under 2 years after the headlines I showed you earlier. And I think, the key here is feeling listened to, not feeling stupid, not feeling patronized, and trust. Trust is another really big theme. So the connection and presence you get with your patients when you're using this approach is amazing. And it means you're not carrying the burden of feeling responsible for them. People do amazing stuff when you create the right conditions. But it's also, had a positive impact on people around me. So this is a feedback from a GPST2. People have been asking to come and sit in with me because I maybe think, oh yeah, well, how does that actually work? And she came to sit in for a day, and she says she was skeptical about the practical applications of lifestyle medicine, how it could work in an overburdened and disempowering system like the NHS. I mean, the very fact that our National Health Service is described as overburdened and disempowering is striking from someone who's a trainee. And she told me that all her peers want to leave medicine, they hate it. But having sat in and seen this approach, she felt that she could work like this and thrive and enjoy her work. But I think it also has implications for planetary health. She noted that I didn't prescribe a single thing all day. So what I prescribe is books and resources and information and confidence. So as you can imagine, when you have a practice in an area of high health need with no permanent doctors for 2 years, other parts of the system start to feel the pressure of that. And the practice had become pretty notorious across the board, really. And it was really nice to get this feedback. So again, this is just over 2 years after the headlines I showed you about how the emergency department at the hospital half an hour away had started to see a change in patterns of attendance by our patients. And in fact, at the time this was written, attendance by the patients in the practice was well below the Scottish average. I think it was 188, Scottish average is 273, NHS Highland average is 297. And I think this shows the amazing power that this approach has for us to really spend our money where it needs to be spent, rather than this revolving door of people who are seeking an answer for their problems that they can't find in a system that's rather rigid. So the impact on me. So, I can't remember if I said earlier, I was pretty fed up. I was thinking of leaving medicine. I really didn't like being a GP. And, this has been transformational, as someone said in the chat. This understanding of working in a different way has been really life-changing for me, at home and at work. This is some of the pictures of some of the events that I've been a part of, and the BMA did an article on this last year, and I love the title. They called it From Rescuer to Coach. And it's taken my life from feeling quite black and white to very colourful and vibrant and really full of connection, presence and acceptance. And I think that's one of the things I find most appealing about lifestyle medicine, is this message about role of resistance. We don't have to be perfect human beings. It's great if you're an amazing cook and can eat 30 plants a week, but maybe you can't at the moment for some reason. And actually, for me, I've definitely been drawn towards the mental well-being and healthy relationships aspect of the pillars, and I've found that focusing on that and that with my patients has really shifted those heart-sync consultations to really amazing transformational consultations. So that's the website of Wildness Health, and just really happy to take any questions.
So, Kath, thank you very much for such an uplifting presentation, and to both see and hear from what you have done in Invergordon is genuinely enlightening and uplifting, and I hope that the other participants feel the same way after such a great presentation. So please put your questions into the chat. It'd be great to have questions. So, Kath, in terms of what you're doing, I'll start off to get us going. How do you think we can spread what you're doing to the wider locality in NHS Highland, for example, as a first step? Great to hear your views about that.
So I think one of the things I found to be very helpful is when I was an associate medical director for 3 years, and fortunately, a lot of the people that I worked with at that time are now very senior in the organisation, which makes it helpful when you're trying to doorstep people and get their attention about this. So I think there's definitely senior awareness of the benefits of this, because the cost of the practice has fallen off a cliff. They had locums traveling from all over the country, and the complaints have collapsed, and there's quite an awareness. But I think it's trying to get the confidence for people to then spread that, and conversation recently with some of the senior leadership there is that basically they want to see evidence, so they want to take away my enthusiasm and see it on black and white and paper. But it seems that there's support to fund, hopefully, to design and deliver a study of what I've been doing in the practice to measure more objectively some of the outcomes, like prescribing volume and consultation rate, because that's the things that the health board want to see. I should say the practice, I took a job in 18 months ago, and we're now a team of 9 GPs. It's been quite an extraordinary experience. And the 9th GP who's just started has also done her accreditation in lifestyle medicine. So I'd say all the doctors are supportive of what I'm doing and interested and curious, but none of them have done the formal accreditation yet. But the 9th doctor, who's starting next week, I think, has done her accreditation. And I think that's going to help develop things further. We're also becoming an educational hub. So there's a lot of pieces of the jigsaw, and I think, really keen to sort of catch up with BSLM again about how to sort of connect up the dots, really.
That's great. And rest assured, I have an email in my head already to post to you, Kath, because we have a few other connections that are helpful in the area, and we'll be back in touch. But on to the questions. So, a question in the Q&A: how long your consultations are? And you said at the beginning you do 30 minutes, but you've only got a limited number of those in the week. So explain about that for those on the study day to day.
Yeah, so I have a job plan. I have a clinical director who tries to keep me on quite a tight rein. He probably finds me slightly challenging. I think theoretically I have 4 to 5 of the half-an-hour appointments a week. I only actually work 15 hours a week for the practice because I'm also a appraiser, and then I use some other time to do the business stuff. But I think what I would say to people is this is completely doable in 15 minutes, this approach, if you text the links for the resources, which is a bit less powerful. But it's still, I find that people, when you start to have, I think the critical bit is the shifting the dynamic, which I think the 12 questions or the lifestyle medicine questionnaire, depending on if your gut instinct is this is a neuroplastic condition, I think the 12 questions are really, really powerful. If you feel it's more, it's structural, but nothing can be done for the structural thing, and so the person has to focus on daily habits, then the lifestyle medicine questionnaire is really, really helpful with that. So yeah, I mean, I when I do the duty doctor stuff, I use this approach. It's not that I have lifestyle medicine consultations and then I revert to a conventional approach in the 15-minute or 10-minute. Some of my appointments are 10 minutes. This is a generic approach that I use across the board now. So when someone consults an emotional crisis on the duty doctor list, I use this approach over the phone, having them met them face to face before, and I text them links to help them make sense of their symptoms. And then I'll normally offer them a follow-up appointment, the half-an-hour appointment, but it will generally be in about 4 weeks because of capacity. So I think it's not unheard of for GPs to offer double appointments to complex patients. So it is possible sometimes to do that, but I would encourage people, I think, thinking about that circle of control. You might not be able to get the half an hour negotiated, but if you can't, just start with what you can do, which is this shifting power dynamic, moving from rescuer to coach.
That's great. That's great. And there's a follow-up from Tim about the follow-up rate. Does it reduce?
Yeah. So I've been so busy kind of refining the framework that I haven't really collected any data yet. And that obviously is what I need to do now. So it's difficult to say. And I think when you're biased about something and you're an enthusiast, you think, I will only follow people up a couple of times. And when you look back, you actually followed them up more than you thought. So I can't give you any stats on that at the moment. But what I can tell you is that, people just have the most extraordinary experiences. So I had a 74-year-old woman who stopped. I think I had 2 half-an-hour appointments with her. She stopped all her pain relief, counted her knee replacement. So she's one of the speakers at one event. I'm doing at the end of this month. People make these incredible shifts. So my gut instinct is, if you follow that up over 12 months, the attendance rate will go down, the prescribing will go down. But I can't give you stats on that yet, and that's obviously where I'm at in terms of convincing the health board to support a rollout of this.
Excellent. And we've got another question from Emma about, do you run late in your other normal GP appointments?
Well, I think I'd say my timing of appointments is very inconsistent. So for conventional things, I could do a consultation in 3 minutes, but it won't be uncommon for me to spend an hour with people. So I spend as long as I think someone needs. No one seems to complain about that. So no, I don't run to time, so don't come and see me if you want me to run to time. But if you want me to really listen to you and help you shift forward, then come and see me as a patient, So yes, I do run late.
Yeah, I having been a GP once upon a time, I can completely
Yeah.
that. Yeah.
But I think the important message is when I get home, I'm not tired. I'm energized and I'm inspired by what the patients are doing. So it's not that I run late and then I get home and I'm exhausted and stressed out. That's not the case, and that's why I was really keen to be invited to speak about this at this particular event, because I think it's not just patients that benefit, it's us as health professionals.
Yeah, and that's what we want everybody to experience, and that's where we want all of clinical practice to feel like for clinicians. Yeah. Now I'm conscious of time, so there's one last question from Kirsty, and that's clients with low motivation who are on dopamine blocking drugs. Any tips on how you manage them?
So I think, was it Kate was saying early on when she was talking about patients asking for sleeping tablets? So what I would say is really before you start talking about removing anything, introduce the new approach. So I think it's So I think it's really that circle of control. So people may need to have those medications, right? They may be essential to their other health conditions. But I think trying to get people and ourselves as health professionals to get out of a place of feeling helpless and hopeless and into a place where we focus on what we can do. So I think Andrew Huberman's got some really interesting stuff about dopamine and focus. So again, I'd be looking for resources that can help people make sense of their experience. So why those medications might be causing problems with dopamine, and what strategies are within their control to overcome that. So cold water immersion, I think, has quite a role in dopamine and can help with motivation. So I'd be looking at, because of my practice area and because of my interests, I'm particularly interested in things that people can start for free right now. So I'd be looking at some Andrew Huberman stuff with them and talking to them about cold showers in the morning and that kind of thing.
Great advice. Thank you. And thank you so much for your presentation today. So I will hand over now to Christine Taylor, who's our next speaker on looking after yourself and supporting your well-being when experiencing challenge with mental health. So welcome, Christine, and over to you.
Hi, thank you for inviting me here today to talk about looking after yourself, supporting your well-being while experiencing challenges with mental health. My name is Christine Taylor. I'm a mental health nurse. I've been qualified for 10 years now. I worked the first half of my career in the NHS in acute admissions and eating disorder units, and latterly I worked for a Scottish university supporting students to maintain and look after their mental health while studying. I joined the BSLM in 2021 and completed my diploma that year, and have been a member ever since. So today we're going to be focusing on stress. Firstly, we're going to recap what stress is, how and why it impacts us, and I'm going to then take you through 10 tips to manage stress and hopefully have you feeling confident about how you could implement at least one of these into your routine. So stress, what is it? So stress is a bodily reaction to feeling threatened or under pressure. When this happens, we release hormones, adrenaline, cortisol. This is useful. These hormones motivate us and prompt us to act quickly. We go into a fight or flight mode, which I'm sure some of you are familiar with. It is useful. This keeps us safe. However, when stress is not resolved or when we are constantly exposed to stress, this can then become problematic because that stress cycle doesn't turn off. This can leave us with feelings of irritability, tearfulness, feeling overwhelmed. We might physically notice things like nausea, headaches, dizziness, feeling faint. Our blood pressure can increase. We may notice changes in our behaviours. We might be snapping more at loved ones or using maladaptive coping strategies such as increasing alcohol use or substance use. We might also notice disturbances to our sleep and dietary patterns. At times, causes of stress are within our control. These tend to be acute stresses, for example, giving a presentation. So I'm stressed about that. It motivates me to work harder. I then deliver the presentation, hopefully it goes well, and I feel better afterwards. So we've got an end to that stress experience. We've closed that cycle. However, the causes of burnout are likely not to be within our control. So in this situation, we need to think about how we turn off that stress response or how we turn off that stress cycle. And the way that we can do that is by managing our response to stress. That is within our control, and that control itself can help reduce feelings of stress. It's empowering to know what we can do to help ourselves, basically. So top tips for managing stress. Number one thing you can do is move. Movement helps us work through stress. It's a physical outlet and can help us clear the mind. Movement can be a formal exercise. It might be class, going to the gym, going for a run, or it could be going for a walk. It might be doing some stretches at home. It might be dancing in the kitchen to your favourite song. All movement can count, and it's about finding the movement that works for you, something that you are happy doing. Movement helps in the moment of stress, so it can be great to do after work, at the end of a shift. But actually, if we build that up over time, it also has a protective mechanism as well. By exposing us to stress in the form of exercise, it helps our body sort of learn how to respond to that. The next two I want to talk about are breathing and mindfulness. Now, these can be a bit controversial in my experience when supporting people. And I think this ultimately comes from, we've all had that situation where I think we felt maybe quite stressed or overwhelmed, and somebody says, calm down, take a deep breath, and you feel worse, because ultimately what they've done is they've just dismissed how you're feeling. But I think the strategies of mindfulness and breathing with themselves can be really useful. And sometimes it's understanding why they work that makes it easier for us to engage with them. So firstly, breathing. If we think back to how stress impacts the body, it can increase our respiratory rate. So by deliberately slowing down our breathing, we're tapping into that mind-body connection, and we're actually signalling to our body then that we are safe. There are loads of different ways to engage in breathing techniques. Some of my favourites that I'll often recommend to people are always going to be simple. So counting your breathing. So we might breathe in for a count of 4, hold for a count of 5, breathe out for a count of 6, and we repeat that for a few cycles. For the visual sort of learners amongst us, box breathing can be great. So you visualise a box in front of you, and you're going to breathe in as you come along the top of the box, you're going to hold as you come down the side, breathe out along the bottom of the box, and hold again as you come back to the top. And again, repeating that, and that visual cue can be really useful, because again, it's slowing that breathing down. I also like to talk about belly breathing, which is, if you've ever done a yoga class or engaged regularly in yoga, that might be familiar to you. And essentially, I think this is great for those of us who experience comfort through physical touch. So essentially, you just put your hands on your belly, and as you breathe in, you want to expand your belly and feel that. And then as you breathe out, you feel your stomach can contract and pull back in. And again, repeating that for a few cycles. These are great ways, all three of them, to engage in your breathing and deliberately slow it down, which is going to help give us that sense of reducing that stress. Mindfulness. Often those I'm supporting panic at the thought of sitting with their thoughts. If you're already feeling stressed and anxious, the thought of someone saying just sit still and quiet and let those thoughts pass is really difficult. So I tend to think of mindfulness as a less formal meditation, and in that way it's a bit of a gateway to meditation. It can be a bit more accessible or available to us. So essentially what we're doing when we're being mindful is just tapping into that present moment. I think an easy way to do this is to ask yourself sensory questions. So what can you see right now? What can you hear right now? What do you feel? And this is a great way to get us thinking about what's actually going on in the here and now. And while we're doing that, it's also not possible for us to be engaging in those worrisome thoughts, all the busy stuff that's going on at the back of your mind and that stress. So it works on a couple of fronts. It's a distraction, and it helps us tap into that present moment. If mindfulness is something that you're interested in, there is a wealth of resources out there freely available on the internet. YouTube's great. There's also a couple of well-known apps that you can tap into engaging in mindfulness or meditation in a way that feels right for you. Okay. Next thing to think about is talking. So we've probably all heard the phrase, a problem shared is a problem halved. Talking to our loved ones is a great way of building connection, feeling supported, maybe getting advice if that's what we're looking for. But interestingly, I think even small talk with other people is useful here, because that also helps us build connection. So it's not necessarily having the deeper, meaningful conversations. Sometimes it's just that small talks, just that chat about the weather, what you watched on TV last night, what you had for dinner. It all helps us build social connection. It's the social connection and not feeling alone or isolated that can help reduce feelings of stress. I wanted to mention laughter in here because I just find this one quite interesting, but laughter in itself is a great way to build social connection. And there's some really interesting anthropological thoughts around laughter as a safety signal. So engaging with laughter can also be really stress relieving. So it might just be laughing with your colleagues. It might be watching something funny. It might be reminiscing even on something that's been funny before, but engaging in laughter can actually be quite a useful stress reliever too. Time in nature. So getting outside allows us to physically move away from the stressful environment, perhaps your workplace. We get fresh air, we get much needed vitamin D. Being in nature is proven to improve stress and reduce blood pressure. There's a wealth of research regarding green and blue spaces and the patterns that we find in nature, like fractals, the repeating patterns. If you're not able to get outside, actually even having nature inside, whether that be plants if that's available in your workspace, or even pictures of plants, wall art can be a great way of bringing nature in if actually getting outside isn't possible. So that's a nice one to think about for sort of staff room spaces, I think, actually. I think it's important to note here, to think about layering. So if you can layer time in nature with physical activity, you'll be increasing your opportunities at reducing stress. Bonus points, essentially. If you can put a couple of these things together, we're likely to get much more out of them in terms of a stress relief response. So moving on, we've got gratitude. So often our negative emotions are feel loud, or we experience them deeper. They take more of our attention than our positive emotions. So practicing gratitude is a helpful reminder that good things are happening. They're happening alongside our challenges, but they are still there. So simply asking yourself, what made you smile today? What you feel thankful for? What you feel grateful for? I think the wording there is quite personal, because slightly different variations will resonate with you differently, but essentially focusing on what 3 good things there might be that day. Now, to start with, if you've not done this before, 1 thing might be enough. That might be challenging to find actually on a really difficult day, but over time hopefully you can build that up to 3, or maybe some days you'll even find more than that. This can just be something you do as sort of like a mental exercise. Maybe you do it on your commute home from work. It might be something that you actually write down in a notebook, or you use an app on your phone or something to keep them on. I've seen it nicely referred to on social media as kind of finding glimmers in the day, which I think is quite lovely. Writing it down, it certainly takes me on to my next point, which is to think about journaling, so more of a writing practice, as it were. So journaling is a great way to help us process difficult emotions or situations, such as experiencing burnout. So journaling can be written down. It can be in a nice notebook if you like stationery. You can do it on a note app on your phone. You can do it through an app. There's lots of different ways that you can journal, and how we journal can be quite different as well. So you can free journal, write whatever's on your mind. I'll often think about this technique with students that I'm supporting, and we'll call it a brain dump. So it's basically just like getting everything out of your mind down on paper. It can be a really useful way of clearing your mind, and actually I find that one, or what people report to me, is they find it quite useful if they're struggling with sleep. If that mind is really busy when they're trying to sleep, a brain dump before going to bed can be quite a useful way of tackling that busy mind that can delay sleep. If you prefer a more guided approach to journaling, Google again is going to be your friend. You can literally just Google search journal prompts for stress, and you'll find a whole load of them. 2 that I particularly like, or maybe encourage people to use, is first to ask yourself a question about your worries as if you're talking to a friend. Often this helps us to explore them in a slightly different way, and it also taps into that self-compassion, which is really important for our general well-being. A second activity that's quite different but I quite like is to think of a place. It might be real or it might be imagined, and I want you to place yourself in it right now. Feel comforted, feel relaxed, and then I want you to describe it in as much detail as you can. So get all of that written down. So this place that makes you feel really comforted and supported, describe it all, and that's your journaling activity. Leading on from writing, I think it's good to think about other forms of being creative. So doing things that are creative, or being creative, is a great way, again, to help us process our emotions. Often great artwork, great music comes from quite challenging emotions or challenging situations. Having said that, our creativity doesn't need to be a masterpiece. It can simply be being engaging in creativity. It might be drawing something, it might be doodling, it might be colouring in, it might be playing music, it might be knitting, crocheting, the whole world really is your oyster here. Creativity can be endless, can't it? But the actual act of making something can help us process and manage that stress. And I think this can also tap into nicely about doing things that we enjoy. I think when we're stressed, we don't feel like we have the resources maybe to engage in things we enjoy, or maybe we actually don't feel like we enjoy them as much anymore. But it's so important that we build back some enjoyment and some fun into what we're doing. And you might tackle this in, again, like layering in creative hobbies, thinking about things that we enjoy. It might be meeting a friend for coffee. It might be reading. It might be trying a new recipe even. And what we know about doing things that we enjoy, or doing things that are creative, doing something maybe new recipe, a new knitting, sewing pattern, doing new things is a great way to build up our self-esteem, which can often be negatively impacted by stress and burnout. So again, we're thinking sort of the layering of activities here that again gives us that kind of bonus response, if you like, to stress management. I did want to mention sleep here. Sleep is often something that can be negatively impacted by stress. A couple of the techniques and things that we've already discussed will also help with sleep. Physical activity sometimes can aid with sleep. Journaling, mindfulness, these can aid with sleep. I think if you are struggling with sleep, there are some brilliant resources out there for managing poor sleep or managing sleep difficulties. Sleepio is an app that was developed by the NHS. It's really useful, and I often recommend that to people I'm supporting. And again, using NHS resources online is a great way to tap into sleep resources. So we've discussed 10 tips that we can use to manage stress, but how do we actually do these? How do we build these into a regular practice? Because ultimately, you know, we could do them once and we might find them useful and that would be great, it might help us in the moment. But what we want to do to manage stress over time is to make these things regular, to make them part of our daily habits. So building them into our routines is going to be really important. So I want you to think back and pick an idea that resonated with you of the 10 that we've discussed. And then I want you to think about how could you build this into your routine or build it into your day or after work. So could you maybe be adding a breathing exercise into your lunch break, for example? Might it be adding in movement onto your commute home? Might it be, you know, depending on the times, obviously you may be working shifts, all sorts, but is it adding in some time outdoors in a break on your way to work, on your way home for work? Is that something that's available, time in daylight at those, depending on your shift patterns that you're working? Best ways to build habits are to start small. This makes it easier for us to engage with, even when our resources aren't there. When we're stressed, we often don't feel like we have time, we don't feel like we have the energy, we don't have the energy for engaging in these things. So keeping our habits small means we can engage with them even on days when we're feeling bad. So for example, you might be inclined to think, right, I want to add, you know, 3 runs into my week. Well, actually, would it be more realistic to be thinking about, can I get 3 walks in? And then on some days you might feel like running and it's great, you can go on and do that. But actually on days when you're really struggling and you're really tired, quite exhausted, then actually a walk is still something that you can achieve. And that achievement's really important, again, for helping us build that habit and making this a regular practice. So it could be something like, we've talked about running, we've talked about breathing techniques. Is it putting your favourite song on when you get in from work and dancing in the kitchen to it? Some days you'll dance for half an hour, some days you won't, but can you build that in? Helps us with consistency as well. Make your habits rewarding, which might sound obvious, but I think sometimes we overlook that. I think we can often focus on, you know, removing behaviours we don't want, or, you know, changing habits we don't want, but we don't necessarily think about adding them in and making them enjoyable for us to do. So if you're taking, you know, the example of a movement habit that you want to start, how can you make that more enjoyable? Is it going to be listening to your favourite music while you do it, your favourite podcast, listening to an audiobook? If you're journaling or engaging in stretches or yoga at home, is it doing that with a scented candle to make it more enjoyable? If it's enjoyable, you're more likely to engage in it and more likely to stick with it. So in summary then, because I'm conscious that I'm running out of time here, so what we have done, we have recapped what stress is and how it affects us. We have discussed 10 stress management techniques and considered how we could build these into our routines. So I want to leave you with a final question for today. And that is for you to think about one thing you can commit to today to help you manage stress. I hope you have found this helpful. Thank you so much for listening. Oh, finally, sorry, before I go, I do have some resources to share with you. The first is to look at Every Mind Matters, which is a fantastic NHS wellbeing resource. For those of us that maybe need a little more guidance with this, it takes you through a 5-question quiz and helps come up with a personalised wellbeing plan for you. The Mind to Mind website from NHS Inform has a wealth of resources on there about stress and stress management, and it's a really great resource to engage with. I did also want to mention the following 3 professionals who all are active on social media. We have the brain doctor, Dr. Faye Baghetti, who is a neurologist and neuroscientist, and she has great information around understanding how the brain works and understanding what it does. Can be really useful when we're thinking around changing our behaviours, managing stress. The Psychology Mum is based here in Scotland and creates wonderful images that beautifully illustrate concepts of mental health and wellbeing. And finally, Dr. Claire Ashley, a GP and NHS entrepreneur who herself has experienced burnout and is now using her expertise to support other professionals through burnout. All great resources. just as a final add-on, if you are worried about your experience of stress, or you're trying out these techniques and they're not cutting it, please do seek support via your GP in the first instance. Again, thank you very much for listening today, and I look forward to answering any questions you may have. Thank you.
Thanks very much, Christine, and really helpful to get your insight into stress and the fact that it's natural and it's a reaction to what happens in life, but important to hear all your tips for how we can manage that. So please put your questions in the chat. Can I start, Christine, about saying, what brought you into, first of all, working with students, and then into, working more generally with people to help them and tackle stress?
Hi, thank you. Yes, so I've been working in the university for about 5 years now, and I think the move to work in the university for me came from working in the NHS and working in acute mental health care, and I suppose probably feeling a little bit like I didn't get to use all the skills that I was trained to use, and wanted to use some more of those on a one-to-one basis, which perhaps wasn't the priority maybe on the ward, and moving to the university sector, sort of the private sector, there's maybe more resource and opportunity to do some of that one-to-one work that I maybe wasn't getting the same opportunity to do in the NHS. So that was a big part of it. I think working with young people, obviously predominantly at university, it's around about the sort of 16, certainly here in Scotland, 16 to 24 age category. And I think it's a brilliant age to be working with people to create lifelong habits around looking after their mental health and well-being. Obviously it can be done at any point, but I think there's it's a really good age group to tap into, sort of tackling, sort of building habits and maybe changing ones that are emerging that aren't quite so helpful. So hopefully that answers your question there.
It does, thanks, and look forward to seeing other questions pop up in the Q&A session, if that's possible, if people have things. And you've given us some great resources there in terms of those links for people to follow up, so that's really helpful. Thank you.
No problem.
I don't see any other questions popping up. Yeah. Anything else that you want to particularly say to those that have joined us today from your experience of working in the NHS and now in different ways with people?
Oh, that's a good question. I suppose I think I'm very lucky, I think, in the position that I'm in now, certainly, in that I get to work in quite a lot of different ways. And I think that was something I thought a lot about moving into this role, and actually something that one of the followers or one of the accounts I mentioned, Dr. Claire Ashley, talks a lot about how to like portfolio careers, maybe diversifying what we're doing to making sure that we are getting bits of what we enjoy. Obviously, I'm sure there's, for all of us, bits of the job that are really challenging and really difficult. And I think it's really hard when actually the most of what we're doing starts to fall into that category. So finding whether it's opportunities or, perhaps different ways in working sometimes. I mean, even coming along and having the opportunity to do this today is such a lovely way to use my skills in a slightly different setting that brings me a lot of enjoyment. And I think that's really important to managing a lifelong career in healthcare, is finding that enjoyment where we can.
That's really good advice, because I know how challenging the work can be in the NHS at the moment. So anything that can help people to get that balance in life about things that are good to do and things that really help them to relax and unwind and get a sense of purpose rather than being constantly feeling stressed at the end of a day. It's really, really good. And we've had a comment rather than a question popped up in the Q&A from Caroline about another resource, which is Free as Action for Happiness, the website. So that's another great pointer for people to have a look at. So thank you so much for that. And saying that finding the joy in what we do is crucial to life. And I couldn't agree more. It was really important. So there aren't any other questions that I can see, so I'm guessing that quite a lot of people are getting ready for lunch. So Christine, can I just say thank you very much. It's been really helpful to hear your top tips and the resources that you've pointed us to for being able to get that balance in our own working lives. So thank you very much. It's been a pleasure.
Thank you so much for having me. I hope you enjoy the rest of your day. Thank you.
I'm sure we will. I'm sure we'll look forward to the afternoon. Great. Thanks very much.
Take care. Bye-bye.
And thank you everybody for joining us. We now have an hour for, not an hour, we have 50 minutes for lunch. So please move around, have some nourishing food, and we'll see you back at 13:40. Thank you.
Hi everyone, welcome back. I'm pleased to welcome everyone back for this post-lunch section of our day. For those that don't know me, I'm Emma Mulligan, COO here at BSLM. And after some of the challenges we faced this morning, also local IT, which is certainly not my usual skill set. So thanks for bearing with us through those technical challenges and some of the sound issues. But hopefully it'll be smooth sailing from this afternoon on. And as a charity, our main goal is really just to get the message of what lifestyle medicine is and how it can help you, as well as your patients. And so I hope that wasn't impacted. I managed a little windy wander out here in East Lothian. I hope you did as well. And we'll be kicking off today with Dr. Joe Watkins, followed by Adam Smith, both very well known in our BSLM community. So thank you both for joining us. Over to you, Joe. You can share your screen.
Hello, hello, hello. Well, I am hoping that I am not going to have some tech issues here. So I'm just going to quickly share. We did check it all before. So hopefully this will be seamless, but there's nothing like a bit of a tech issue. So well done with everything this morning. What I saw was fantastic. So I'm hoping that you can see a big pink screen right now. So if somebody can let me know that you can, that would be helpful.
All good.
Great, excellent, fantastic. So welcome back. I've got the kind of graveyard post-lunch shift, so I hope you've had a nice light lunch and a walk or a dance or anything else that you needed to do to get ready for this afternoon. So I am here to talk to you about this mythical creature that is work-life balance. And this kind of came about because of my work now that has evolved into working for myself. So there was chat about whether I talk about being a digital nomad, what that looks like. But actually what I want to do is kind of bring everything together, talk to you about work-life balance and about how you can be authentically you, whether it's in medicine and healthcare, whether it's in your family life. And I want to share with you 7 things that I've learnt along the way. So that is me. My name is Jo Watkins. I am the host of the Startup Support Surgery, which is a podcast. I have a program called the Startup Support Program, which is under this umbrella of the Digital Doctor. I help people with logos and websites and all of that kind of stuff when they're starting out. If you want to find out a little bit about me, my website is there, jowatkins.com. And if you scan that QR code, then you will be able to sign up for my newsletter, which is basically the simplest way of keeping in touch with me, because I write a newsletter every week. And if there's anything helpful along the way, it'll be in that. So please feel free to reach out to me, send me an email, connect with me on LinkedIn, wherever. Right, now let's move these forward. So hopefully that is moving forward. I am not here to tell you to leave medicine and healthcare. I'm not here to tell you to stay. I'm here to kind of open your mind to the possibilities that could run alongside what you're doing now and could help support you in making the future what you want it to be. So I'm not here to tell you what to do. I'm here to just share some of my experiences. And I am here to tell you that for the next 20 minutes, you are allowed to be as much of a dreamer as you want to be. Okay, so I want you to just think big. And I want you to think what is possible rather than what is not possible. That is the only ask that I have. So I have had to write this down on the right-hand side of this slide. Anyone that's heard me talk before will probably be thinking, well, I've heard all this before. What's she going to tell me this time? But just a very, very quick introduction. I am a GP. I left my GP partnership back in 2010, but I remain working on a regular basis. And that came about because I took lots and lots of different small decisions. I actually, if you'd said to me this time 5 or 6 years ago, you're still going to do an on-call day on a Wednesday, I would not have believed you. I hung in there at my appraisal meeting back in probably 2019. I said, I'm done. I need to leave. And actually what happened then were a series of kind of random opportune connections that has led me to now have an incredibly flexible working life within a practice that I'm a long-term sort of locum as and when I'm in the country, which is an incredible privilege, but it has come about through building relationships and connections. It's not come about by accident. So I've done a whole load of stuff on the way. I've had a granola business. I have traveled around the world for a year with 4 kids. I have started an online membership for teenage girls, and I now coach and mentor other medics who are interested in starting their own business or doing things differently, all built around this pattern of work that my husband and I have now created, which is where we're in the country for 9 months, and then we spend 3 months traveling. So in a nutshell, that is why I'm here today to talk to you. And this talk came about because one of my clients relatively recently sort of approached me with an idea, and he said, look, I only want to do this project if I know it's going to be a success. I'm only going to spend time on it if it's going to be successful. And I said, well, there are no guarantees in this world that anything we do is a success. And what does success mean anyway? And it got me thinking of all of the things that I've done over the last 15 years. You know, what is success? What does that look like? And what does success looks like to you might not be the same as what success looks like to me. So those, you know, the aspects of success, is it about the impact that something has on you? Is it about the impact that it has on other people? We've heard some incredible stories this morning of people making a real difference and a real impact onto their patients. Is that successful? Is it about how it makes you feel? Is coming home at the end of the day not feeling burnt out? Is that successful? Is it about reaching clear financial goals? The internet would have you believe that it is possible to earn, you know, 6 figures in 4 months from the end of your computer while working for 2 days a week, sitting on a desert island. It's not possible. It doesn't happen. But is success reaching clear financial goals? Is it about a clearly defined personal goal? I think for us, there were various personal goals along the way. And I think that has been one of the drivers. So personal goals is important. Is it about this mythical work-life balance? Is it just about nailing life and feeling like you've got it all sorted? Is it about learning new skills? Is success about personal growth? You know, we have a habit of accelerating and jumping through the hoops, and obviously GCSEs, A-levels, medical school, and then the hoops after that. And then sometimes there's a bit of a plateau. It's like, oh, I've got my consultancy, I'm a GP partner, what's next? And I know a lot of my friends have stayed at that point and they haven't necessarily gone out there and done other things to grow personally. So is that what success is about? Is it about experiences? You know, we're not on this earth for very long. Is it about collecting experiences and memories? And I think we need to remember that if we do start up something differently, whether it's a hobby or whether it's a business or whether it's something alongside our medical careers, the potential ripple effect of what we do and the impact that it has on everybody around us is really difficult to quantify. So all of these things are successful, I feel. So just looking back at I think there's probably 4 big projects that I've done over the last 15 years. Were they successful? And did they give me a work-life balance? So Bendy Legs Granola, which was a 3-year business that went from nothing through to selling in, you know, markets up and down the country. I won marketing awards. I was in Olive magazine. I had a phone call from Amazon about stocking it. You know, outwardly, all of those things are hugely successful. This is a very successful business. I mean, the reality is that I didn't pay myself anything at all. All of the money went back into building the business, which is not unusual for a business like that. The food sector is incredibly competitive. And actually, when Amazon rang me and they said, we want to stock as much of this granola as you can make, they were offering to pay £1 a packet. And because of the ingredients I was using, it cost me £2.50 to make. So immediately there was this disparity. And they said, well, just, you know, cut your profit margins by sorting your ingredients out and compromising taste and whether or not it was good for you, etc. Anyway, my point being that this business was hugely successful to me because I absolutely loved doing it, but my work-life balance was terrible. I was pregnant with child number 3. Our oven was full of granola. I didn't have any weekends that I wasn't sitting outside in a market stall, traveling around the country, everybody involved in it. It was a lot, right? So work-life balance wasn't there. but success, you know, arguably it was successful, and it was, you know, I don't regret anything I've ever done. I have to put that out there because it's all a work in progress, but the work-life balance wasn't there. Secondly, the how people, that was an idea that I came up with when we were away traveling. We had a huge impact, and we still continue to have a huge impact locally. We did lots of charity work. We've worked with lots of organisations. We've taken lots of girls surfing. We've won environmental awards. We've partnered with the NatWest Bank, Princess Trust. We've raised loads of money for charity, done all sorts of stuff, and it's been incredible. Again, we haven't paid ourselves. Everything's been reinvested in the business, but the ripple effect of what we've done has been massive, and the potential for us in the future is huge, and we both absolutely love it. But that balance hasn't been there all the time. It's been something that we've absolutely loved doing, but we're both in different places. Polly, my business partner, she's got younger children. You know, this was having a big impact on both of our lives. And for the moment, we are just running it. It's going along in the background, but we've had to take a step back because the balance wasn't there. And any one of you on this call that runs your own project or is running your own business will understand that it takes over your life. So success, balance, this is what I'm talking about, right? At the moment, I feel like I've got a reasonably good balance because I'm still able to operate as a GP, and I'm now coaching and mentoring other medics from the end of my computer wherever I am in the world. And I feel for the first time like I've got more of a balance. I did a bit of a time audit recently to check in on how I was using my time and what I was doing, and I'm definitely spending more time with the family in the evenings, and I'm a little bit better at working out when I'm working, when I'm not working. And that picture on the right-hand side is me and my daughter, both of us working in the back of a van recently when we were in Thailand, and I'm just working as and when I can, as we are on the move, which is an incredible privilege, but I am much more mindful of what I'm doing than I was. But I think out of everything that we've done over the last 15 years, this has been the thing that has given us a huge amount of success, and I mean impact for us, for the children, the ripple effect of their things that they're going to do in their life, and the balance of spending time with our children, but also, being able to experience stuff ourselves. And I want to share this with you because there are people out there, and I know there are because I've done several talks with BSLM, and many, many people ask me about this and about travel and about possibility and about how you go about doing it. I think a period of time that isn't a 2-week holiday, away from your normal life, with your family, can be one of the most enriching things that you can do. Now, it doesn't need to be a year. It doesn't need to be 3 months. It could be 3 weeks, 4 weeks, 6 weeks, a period of time where you're traveling in a slightly different way. I think that has been the thing that we've done in the last 15 years that's given me the most joy and given me the most takeaways as to how I really want to live our lives. So this was our year in 2017 to 2018 with 4 kids. So, is there a possibility? Is there room in your life? Is there a possibility for you to take a bit of time off with the children? Now, I know there's going to be people sitting there thinking, what is she on about? Like, how can this possibly even happen? But there are many of you that have had this as a thought process, and that there have been various practical things that have stopped you doing it. What it's opened to us is a different way of living. So before taking this time off, we would never have imagined this possibility of annualizing our hours, for example. So Dave's an anaesthetist, and he approached his work and he's annualized his hours. So he does all his work in 9 months, and then we have 3 months where he's not working. And then I locum, so I do all my work in 9 months, and then I'm now doing my other work while we're away as well. So I tend to work while we're away and he doesn't. So we have an annualized hours contract. We've shifted the perspective in our family, particularly around education, massively. We feel like we've now created a bit of a legacy that the kids certainly are now understanding. The bottom right hand photo was us last month. We just took it just over 3 weeks. We were in Thailand, And, you know, my eldest is 18 now, 16, 12 and 10. And, you know, their bonds between the four of them, when we're at home, life is so busy. They're all doing their clubs, or my oldest are working. And, you know, there's a lot of comings and goings. Whereas when we're away, we're all invested in the learning and the connections that we make along the way. And it really is very special time. We've spent a lot of time in Canada where my cousins are, so we've developed a relationship with them. We've established this kind of individualized education for, you know, we understand what our kids' needs are, and we're able to kind of adjunct onto the state system when we're at home as to what their interests are. And I'm not sure I really ever thought about what their interests were particularly. I just went through the system prior to this happening. Travel opens possibilities. We know that as adults, and I think it opens possibilities and opens children's eyes. This doesn't need to be about lots of time. This is about, you know, slow travel and connecting in a different way. It's about thinking how you can do this that is slightly differently. And house swapping for us has been, you know, the reason we can do any of this. And house swapping is something that I could talk about till the cows come home if anybody wants to ask me about it. And it doesn't really matter where you live. If you're in, you know, you've got an apartment in the middle of a city, that is as sought after as anywhere else. So house swapping is key to this. Building connections with new people is key. I think travel builds resilience. But taking time out of school and everyday activities improves our kids' social skills. Sitting in a classroom with 28, 30, 34 kids their own age, as opposed to, you know, mixing with other people on the road, meeting people as they go along, the rich conversations that happen. And I kind of feel like I get to know my kids better for those 3 or 4 weeks. We literally got back on Sunday. We've had, you know, like I say, 3 weeks in Thailand. As soon as we get home, everybody scatters, everybody's doing their own thing. And we have to really bring that in and deliberately try and make that happen on a regular basis to connect with them. And how many years do we get our kids for anyway? People say 18 years, but actually by the time they're about 12, they don't really want to be with you very much anyway. So I feel like we're kind of eking this out for as long as possible. But before we took that year out, I mean, there were so many things I could have put on this slide, but these are things that people outwardly said to me, you know, they're going to miss out on so much. What about all their clubs? You know, what about their education? You know, they're going to be behind. You know, what if it doesn't work out and you have to come back? I think that was my parents' biggest fear, because we rented our house out. We had summer holiday let, we had a long-term let, then we did house swaps. You know, she was like, well, what's going to happen if you have to come back? And we just knew that we'd be able to work it out. But people were really concerned that our children were going to really struggle and not fit back into society. And somebody quite close to me, you know, I remember vividly her saying, what happens if you lose your place in school and you have to homeschool them when you come home? And she thought that was hilarious that I might have to do that. And actually, that's exactly what happened. But that turned out to be one of the best things that has ever happened as well. So there was lots of negativity. And whatever you do outside of healthcare, whether it's a hobby, whether it's a business, whether it's travel, whatever it is, you are always going to have those naysayers and people criticizing what you're doing. And sometimes people actively trying to sort of sabotage what you're doing. So you have to do this stuff despite what others may say to you. So what I want to do is pull from that quickly the 7 things that I've learned along the way, which are things that you need to address and you need to embrace if you want to do things differently. As medics and healthcare professionals, we have been institutionalized to a degree along the way: GCSEs, A-levels, medical school, nursing school, you know, getting the diplomas, getting the people telling us we're ready to move to the next stage and move to the next stage. When you do things differently, you have to be, you know, you have to have that self-efficacy of doing this anyway. Nobody's going to come along and tell you that you're ready. And there are things that I've learned along the way that I think are entrepreneurial traits, but actually I think you can bring them into whatever you're doing. We did a session with the NatWest Bank, with the How people, and within the NatWest Bank, they talk about intrapreneurial behaviors. So taking some of those entrepreneurial behaviors and bringing them into an organization. So this is for you, whether you are, never going to consider taking time off with your family, whether that's just not even on the cards for you, how can you bring some of those mindsets into your working week and your working day? Okay. So the first thing is curiosity, being curious. That picture on the left-hand side was not taken in the rainforest. That was taken in a park in Swansea. And that was taken about a week after we made the decision to go traveling. And this little boy, he's our third child, he basically had gone to nursery school for a year and hadn't smiled for an entire year. Really was quite miserable, didn't really talk, very, very quiet. As soon as we made the decision that we were going to take them out of school for a year, obviously there was a lot of investigations about homeschooling and how you go about doing it. And I realized that so much of it is individualized curiosity. What are the children interested in? How can you go out there and explore those things? How can you learn experientially about what's around you? And we went to a park locally, and there was some tadpoles. And we kept going back and back and back over the period of a couple of weeks. And we watched the kind of frog spawn become tadpoles, tadpoles become froglets, froglets become frogs. And we watched the whole process. And he was just fascinated. And it was my first experience of seeing that curiosity come alive in one of my children. And that has been my huge take home about educating differently and about doing things differently, is just seeing those. You can almost see the neurons sparking. So if you're curious about something, then take a leaf out of Tom's book, go out there and find out more about it. It might be something outside of your realm within your healthcare job. It might be a new course that's available. It might be a new opportunity. It might be something to do with the IT within your partnership, whatever it is. Get curious, find out about it. Don't say no, say what if, what's possible. And yeah, curiosity is absolutely vital. Courage. I think being brave and doing it anyway is a big thing. That photo is a reminder. We had a big accident in Singapore. My daughter got her fingers stuck in an escalator. It was not pretty. And it threw the whole trip into disarray for a little bit. And everybody was pretty brave. So being brave, feeling the fear and doing it anyway, and learning from those difficult situations, becoming more resilient. Connecting. Travel is all about connection. Find those people around you that build you up. Find those people that are life's radiators. You're going to have people that build you up, people that aren't that bothered, and people that tear you down. Make sure that you're surrounding yourself by the right people, and ask questions of them, because people will support you. Look for those people that are going to champion you and cheerlead you. Confidence doesn't just happen. Confidence, I think, is a muscle that needs working like anything else. You've got to do the reps. If you want to get out there and you want to start being a thought leader about your subject, then you have to get out there and start doing it, and that will build confidence. The first time I did one of these, I remember thinking I was totally out of my depth. Today I was really excited about doing it. So your confidence will grow with you. You don't wake up one morning feeling like you're ready. That's the news. Imposter syndrome means that you're just a beginner, so you've got to grow your confidence. Be coachable. Look at what is out there. Look at the opportunities. Have a growth mindset. Have a look at the possibilities that are there for you and take them. Open those doors. Say yes. Pick up the phone. It's about feeling like you can grow as a person in whatever it is you want to do. And like I say, this might be a hobby. It doesn't have to be a business. It could be anything. So be coachable. Have a growth mindset. Be proactive. You have to bang on doors sometimes to get stuff done. This was Polly and I after we had our art project. We got the funding for the art project. We got given a couple of grand. We could pay local artists. We could run competitions in schools. And now our local RNLI building is decorated with art from local school children. But didn't just happen. We really had to fight for that. So send the emails, make the phone calls, be a pain in the arse to get stuff done. So be proactive and be you, be authentically you, be able to think, what am I really passionate about? What would I really love to do? Because if you can actually be doing something that you love alongside your day job, then guess what happens? Your love of life is reignited, and actually you start enjoying the day job, and the difficult stuff that happens in the day job starts being a lot easier to deal with if you feel like you're living a life that is more aligned to what you're really, really, truly passionate about. So be you. This is the permission to dream. If you want to take a screenshot of this, I've got two sort of journaling prompts. I like this one because actually we are quite good at thinking ahead. We kind of underestimate where we could be in 5 years' time. But I want you to think about what you want the scenario to look like, whether it's professionally or personally. Maybe you want to run an ultramarathon. Maybe you want to do a photography degree. Maybe you want to start a coaching business. Whatever it is, what does your life look like in 5 years' time? Everything's worked out. There's no risks to anything, no judgment. Everything's worked out exactly as you want it to work out. What does it look like? Draw a picture, journal, do whatever it is to get that out of your head and down on something more concrete. I have got Google Drive, which is full of my 5-year diaries. And I just think it's a really powerful way of moving your mind forward to what you want to be doing. Like I say, permission to dream big, dream ridiculous, just give yourself permission to dream, but then let's have a plan of action. Let's have some bullet points down on a piece of paper, things that you're going to do, and then you've just got to do it. And you're never going to feel ready. Nobody's ever going to come and give you permission. You've just got to take that leap of faith and know that the parachute will come. And I do not encourage people to leave solid jobs with good income, because that puts you in a vulnerable situation. But I do encourage you to try and find time for whatever it is you want to do and just do it. I think we make excuses, we keep ourselves safe, we keep ourselves small. If you want to become a concert pianist, or you want to start going into amateur acting, just do it, because then everything will start fitting into place. A few big ones. When you're on your deathbed, would you look back and regret this decision? And we don't like operating like that, but at the end of the day, are you going to regret this being a yes or a no? Quite simple. Take yourself to you being 80 on your deathbed. What does that look like? Were we ever going to regret taking that year off? No. If we'd had to come back and live at my parents' house, would that be the end of the world? No. Were we going to be able to work it out? Yes. Did we work it out in the eventuality of a distressing situation? Yes, we did. Reality check, finances. Everyone always asks me about this. We rented our house, we swapped it, we absolutely maxed on the potential of our house. We remortgaged to get an amount to go away with. We're incredibly strict with our budget when we're at home or away. We don't spend a lot of money on frivolous things, and we didn't before we left. We have to make compromises in what we spend money on, and we basically spend most of our money on travels in chunks of time, and we are earning enough rather than saving, which is not necessarily what people would advocate. So it's very personal. Financial decisions are very, very personal, but there are ways of doing things. Lastly is that if you're not sure about the 5-year thing, if you're thinking, well, I don't really know what I want 5 years to look like, then what about this? If you were starting completely fresh in a world where anything was possible, what would you love to be doing? My husband, that generally involves wildlife and photography. So what can you change? What could he do more of? What could he do less of? How could he bring that into part of his working life? So if you were going to start completely fresh in a world where anything is possible, what would you love to be doing? And that's something I'd like you to have a think about. So lastly, you are never going to look back on your life and think, I really wish I'd worked more. And you're also never going to look back on your life and think, I really wish I hadn't spent all of that time with my kids. Those are things that you are never going to say. So I would just be advocating here. Try and get that balance, whatever that looks like for you. Try and introduce those moments of joy into your time with your family, into your time with your work, into your time with your colleagues, because that will generate and give you maybe the work-life balance that you're looking for. Again, if you want to keep in touch with me, hopefully I've got time for a couple of questions, but I normally babble far too long. That is the QR code again to scan, and just pop your email address in there and you'll find me. These are 2 people that might be a good idea for you to follow. If you're interested in proper 3-week, 4-week adventures and you want some help, Rebecca Ryle has got a fountain of knowledge. She's done an enormous amount of traveling. She's now working for Home Exchange, who are the house swapping website. She's a GP and a great friend of mine. She's amazing. There's not much she doesn't know about family travel. And Emma Presson, who runs Rebellious Medic, she is advocating time off and sabbaticals for helping with burnout. She took a year off herself. She is now still in clinical medicine, but I think there was a point where that was looking pretty unlikely. So she is looking towards helping people and supporting people who want to take sabbaticals. So those are the two people that I would follow. And I'm going to stop sharing and answer any questions that there may be.
Great, thank you. Thanks, Jo. Always great to hear from you. It's always refreshing, I think, to see and hear things from a different perspective. Something you touched on in the beginning was around the what does success look like? And I think the thing that dawned on me is that you spoke about multiple parts of your journey from granola to where you are now. How important is it to just go with the flow and just start, as you mentioned, as opposed to having such a clear plan of this is what my business is going to be, I'll start and I'll keep going regardless?
Yeah, absolutely. I mean, I didn't realize how it is absolutely a journey. I think when I started with granola, I think I was so fixed on the fact that that was going to be the answer, or not the answer, but that was going to be a success. And I think, there's a lot of people around you constantly doubting, as I've said. And I think what my advice would be now retrospectively is to hold your first ideas quite loosely, but give them the opportunity to actually happen and get out there. But that generally it's not going to be your first thing, second thing, third thing that necessarily is going to be successful, whatever that means. Certainly from a business point of view, they generally say it's the third or fourth business idea that actually has legs, don't they? But I think if you wait for all the ducks to line up, it's just not going to happen. If you wait for these perfect scenarios to unfold, it'll just stop you moving forward. So I absolutely think I now think you need to be about 70% ready. Like if you think you've got something, if you think you've got an idea, if you think you've got a solution to a problem, as opposed to an innovative idea, a solution to a problem, every single one of the people on these calls are experts in their area. And I think this is something that healthcare professionals forget, is that you are actually already a leading authority in what you've got to say. That's enough to be able to get out there and make a difference. And I am loving the fact that I can now refer my patients to trusted people on social media. I mean, I do it every single day. And, I hope there'll be resources further down the line for us to be able to signpost, because, just a few talks that I've caught today, I've managed to sort of follow some fantastic people, and there are brilliant people doing fantastic work. And that could be any one of you on this call now. So you don't have to be sure, you just have to be 70%, and you just have to be brave.
How much of that could be applied to not necessarily going all the way and starting up your own business, but how much of that could be applied to starting up an initiative within the NHS? We see many of our members coming on to say they want to start up a diabetes clinic or a weight management clinic or a lifestyle medicine service. How much of this could be applied to that?
Oh, I think 100%. And I think so much of that seems to be luck. I speak to quite a lot of people that if the budget is there and the right person is on the end of that phone call or that email, then it can be relatively straightforward through to other people that have been banging on the door for a long time trying to get something done. You've got to be persistent. You've got to accept the no's. You hear it all the time. Like there was a thing, it wasn't there about the girl that started up Canva. She had 100 no's before she had a yes. We all know about, had the Harry Potter story. It's the same thing. So if you've got an idea and you've got an idea for a project and you want to bring it to life, whether it's as a business, a charity, a CIC, or an NHS project, I just think it's about having that energy to go out there and to really, really believe in it. And then if you believe in it and you speak from the heart and you have the tenacity and the energy to get it done, then that will be taken on by other people. With the How People, we started that as a limited company. And I think if I was doing it again, I would start as a CIC, a community interest company, because of the ability to get grants. and the ability to, we often came across a barrier because we were a limited company. So there are definite advantages of not. But the biggest thing, I think, is to get out there as a person, as an individual, as a personal brand, representing yourself and what you're about, and then everything else will trickle down from there.
Lovely. Thank you. And there was just a request for your website, which Emma Martin will pop into the chat. So thank you very much for joining us, Jo.
No
we're
problem.
going to move on now to Dr. Adam Smith. Let's see if that's going here.
Hello, good afternoon. It's a pleasure to be here today talking to you about lifestyle medicine and what it can do for us as healthcare professionals. And the talk is called The Positive Side Effects of Practicing Lifestyle Medicine. So what are the benefits of doing lifestyle medicine? While we often focus on the medication side effects, today I'll be looking at the many positive side effects of practicing lifestyle medicine, which undoubtedly has lots of plus points for patients. And today we'll be focusing on what it can do for us as healthcare professionals, both personally and professionally. So my name is Dr. Adam Smith, and a lot of what I'm talking about today comes from both personal experience and from the experiences of many of the healthcare professionals that I've worked with. My professional background is that I'm a GP based in the Highlands of Scotland. I took the lifestyle medicine qualification through the BSLM in 2020, and I now have a portfolio of roles, a number of which directly related to me doing the lifestyle medicine diploma. And here's a few of them. I'm an assessor for the BSLM's core accreditation, which is great. I get to read candidate submissions, which include case studies, self-reflections, real-life examples of how lifestyle medicine is making a positive difference in the lives of patients and professionals, and it's all very inspiring. I have a background in medical education and occupational health, where I've had a number of roles. I'm a coach for healthcare professionals, and declarations I've have businesses as well. I'm a co-founder and director of LifeMed Community, which is an online network for health professionals. Through these roles, I spend a lot of time working with healthcare professionals and talking about lifestyle medicine. And through my work, including in NHS occupational health, I've witnessed firsthand the challenges our healthcare professionals face with their own well-being. And it's so important, obviously. We've seen the alarming statistics about burnout, which is awful for the individual, and it directly impacts the health of our population as well. A healthy healthcare force is the foundation of an effective healthcare system. Research studies have shown healthier clinicians have healthier patients, dissatisfied clinicians have less satisfied patients. We've got to look after our healthcare professionals as a society. And as healthcare professionals, we've got a duty to do what we can to look after ourselves as well. I'll start by telling you about my own experience with lifestyle medicine. I found it at a time when I was looking for ways to improve my own health and well-being, as well as that of my patients. In my work, I was becoming frustrated as a GP. I felt I was treating symptoms rather than people, not getting to the root cause of people's issues. It felt like firefighting. I felt like I wasn't helping them in the way they needed or the way I wanted to. And I felt I didn't have the time or resources to provide them with what they needed. There's a good quote from Michael Marmot, which resonates here. What good does it do to treat people and send them back to the conditions that made them sick? In terms of my own health, I was coming from a place of stress, overwhelm, and near burnout. I was caring for other people, but neglecting my own health. My personal life was busy, young family, other personal commitments, and I felt exhausted most of the time, lacking any real sense of direction and purpose. And one afternoon, after a particularly challenging home visit, I found myself sitting in my car, feeling overwhelmed. I noticed a mindfulness app I'd downloaded months before. I was looking into mindfulness at the time and how it could help patients. I never really thought to use it myself until then. In that moment, I decided to open the app up and followed a 10-minute guided mindfulness recording. And I felt a little bit more clear-headed afterwards, a bit more calm, nothing dramatic. Same thing happened the following day. Stressed on home visits, stopped the car again and opened up the app. again felt a little bit better afterwards. This then became something of a ritual. So during the home visit rounds, I'd find somewhere quiet to pull over and do this mindful exercise. And it became something I started to look forward to. And over time, I started to feel a bit better. It was a gradual process, but I noticed the difference. And I felt like I was doing something to take control of the situation. I was really struck by how simple it was to fit this in. And I then started to look at other things that I could do. So specifically, what small things could I do? So really simple things like getting up and moving between seeing patients rather than calling them in on the tannoy, like really simple, small things. And I got interested in what else I could do. So what does the research say I could be doing? Where can I fit these other things in? And I'd experiment with this. And I noticed that I was feeling better over time. I also noticed that I was having more conversations with patients about lifestyle and the small changes they could make. The ripple effect of that one small change was huge, and it ultimately led me to lifestyle medicine. Lifestyle medicine undoubtedly offers benefits for our patients. It's an approach that's evidence-based. It complements a traditional medical approach. It looks to address root causes of symptoms, and it's focused on health rather than disease. We look to empower the individual, putting them at the center of what we do, and we look to understand the why behind their health challenges in a non-judgmental approach. When I started my lifestyle medicine journey, I expected to learn about nutrition and exercise, but what I didn't expect was how much more I gained, both personally and professionally. And I'm not alone in discovering these positive side effects. So through my various roles now, I'm able to work with many healthcare professionals who've embraced lifestyle medicine or who are on their lifestyle medicine journey. And there's very similar themes, similar reasons for finding it, and similar benefits being experienced. And when I've asked what benefits have you experienced, the responses are here. So they include some of the following: improved personal health and well-being. So we immerse ourselves in these principles, we naturally implement them ourselves into our own lives and become healthier as a result. Improved well-being of family, being a better parent, spouse, friend, son, daughter. Connection and community is a common theme. It's we're influenced by the people we spend time with, and it's commonly said being part of this network of like-minded people, these like-minded healthcare professionals with similar interests, is incredibly rewarding and motivational. Greater work satisfaction, feeling like we're making more of a difference, greater sense of purpose, more clarity on values, which has resulted in spending more time with family. People mention finding their ikigai. So this is, you may have heard of, a Japanese term, translates loosely to reason for being. It's this intersection of what you love, what you're good at, what the world needs, and what you can be paid for. And it's a framework that can help us think about balance and purpose, not just in work, but in life as a whole. So people have reported they found their ikigai through lifestyle medicine. So career development, we have teaching, healthcare professionals getting involved with teaching undergraduates, for example, about lifestyle medicine, setting up projects within the NHS, such as group consultations, which are rewarding for the clinician as well as being really well received by patients, and volunteering, local projects. There are people starting businesses aligned with their values, developing skills and interests that can help others, developing a love of coaching. There's so many positive experiences that have come as a result of going through the training and learning about lifestyle medicine even. Lifestyle medicine is made up of, or it encompasses, the socio-economic determinants of health, the 6 pillars, and behavior change. So I think of these as the why, the what, and the how. And the 6 pillars being physical activity, sleep, mental well-being, positive social connections, reducing harmful behaviors, and nutrition. If we start with the what, the 6 pillars provides us with this. So what are the things that we can do to improve our health? In a world of so much information, opinions, conflicting advice, lifestyle medicine has an important role as an evidence-based specialty. And as we learn about the 6 pillars, we naturally implement them into our own lives, and our health improves as a result. And not just our health, but those close to us as well may benefit. And there's some examples on the slide here of some of the things that we could do, a few evidence-based or a few suggestions of things that can be done to help with addressing each of the pillars. And what we choose to do depends upon us as individuals, our personal situation, our preferences, what's feasible, what's going to have the biggest impact, how we decide what we choose to do. One of the things we can do is a self-assessment of how we are doing across the pillars. And there's a number of ways of assessing each of the pillars, and it goes beyond the scope of this short 20 minutes here. There's various validated tools and information we can get from wearable devices, etc. For the scope of this very simple tool to give us a good overview is a Wellbeing wheel. And these can be used in a variety of ways. And typically with a Wellbeing wheel, you'd identify areas in your life that contribute to your well-being and label each section of the wheel with one of these categories around the outside. So here we've used the 6 pillars and left a couple of spokes blank. And for each category, rate your satisfaction with that area of your life, going from 1 to 10, where 1's very dissatisfied to 10 being extremely satisfied. Draw a line across the segment at that level and shade in the section. And rate yourself across each pillar. Exercises like this give us an opportunity to reflect, essentially, and it can give a good visual summary. It can help us to identify areas where there's greater need for improvement, and this can help us with prioritizing where we may want to focus our attention for getting the kind of the greatest rewards from our efforts put in. When I did this, it helped me realize that I wasn't prioritizing my sleep, so I looked at what I could do to change this. Knowing what we could do or what we would like to do and actually doing it can be very different things. So this is where the how behavior change comes in. It's particularly the case with us as healthcare professionals. So we're brilliant at giving advice, caring for other people. We often know a lot of the things that will do our patients good, and we give this advice. And when it comes to ourselves, how often do we follow our own advice? In lots of instances, we know what we could do to improve our health and well-being, but we don't do it. And knowing something and doing it are different things. And we can be hard on ourselves, feeling that maybe we should know better. But according to the neuroscientist Antonio Damasio, when it comes to making choices, it's our feelings that decide for us the vast majority of the time. And unfortunately, how we feel in the moment is often not aligned with our longer-term goals and aspirations, especially when it comes to health and fitness goals. And when faced with a choice, the anticipatory dopamine release that's associated with immediate rewards, like comfort eating after a stressful clinic or scrolling on a phone, this often drives our decision-making more powerfully than our cognitive understanding of what the long-term health benefits might be. And this is often exacerbated by times of stress or tiredness, when our days have left us with decision fatigue. So it's not always easy to make the positive choices. For the purposes of the short time that we have now, I just want to focus on a couple of things that we could do here in this section. And those 2 things are making time for self-care and focusing on small changes. So we need to prioritize self-care. So I'm sure you've heard, like, self-care is not selfish. We need to put our own oxygen mask on first if we want to be able to help others. So we know this, but it really is important that we prioritize our own well-being. You may be familiar with the big rocks analogy from Stephen Covey. I'll go through it just now. So this is where we have a large glass jar, and next to it some big rocks, some smaller pebbles, and some fine sand. And we think of this jar as your life, or your time, your energy, your capacity. The big rocks represent your most important priorities, the things that really matter to you. And I'd suggest that self-care comes in here. The pebbles are day-to-day tasks that feel urgent, that aren't necessarily crucial. And the sand represents all the small stuff, the distractions, the minor tasks that aren't important. If we pour the sand in first and then add the pebbles, when we try to fit our big rocks in, they don't fit. So the jar's already full, but full of the wrong things. It's full of all the distractions. But when we prioritize and put the big rocks in first, and then the pebbles fit around them, and then the sand can fit around and the jar is full and everything is in. Everything fits because we've prioritized the right things first. So it's about prioritizing the important things and being intentional with our time. So the first task is to bring awareness to what our big rocks are. What are those healthy changes we could make? Then the second task is protecting them. And too often we let our days fill up with sand and pebbles and wonder why we don't have time for the priorities. Another thought on this, we often see from personal experience, I feel the need to keep working because I've got so much to do, for example. But not all time is equal. And after working for hours on a project or a busy clinic, we're tired, we're less efficient, less creative. When we prioritize micro breaks or these episodes of self-care, we can re-energize, we can actually get more done in the same amount of time. The other thing to focus on here is small changes. So we have a tendency to underestimate the power of small regular actions. They're often dismissed as they don't seem to matter too much in the moment. And we feel that we have to make big changes in order to improve our fitness, our lifestyle. So it's important to note that it's the small, consistent actions where the power lies. Doing something small but consistently produces much greater results than trying to do something big once a fortnight or once a month. So a 10-minute brisk walk each morning will produce greater benefits than half an hour run once a fortnight. It's all about going like a couple of inches further tomorrow, a couple of inches further the next day than you'd normally go. And then these inches become feet and they become miles and so on. And you end up so much further than you would have thought possible. In his book, Atomic Habits, James Clear describes habits as the compound interest of self-improvement. These small changes compound over time. And if we look at what's the smallest thing we can do, if we have a behavior we want to introduce, if there's something, for example, doing a meditation or a mindfulness, if we feel like we haven't got the time to do that, what's the smallest thing I can do to move the needle to keep momentum going? That might be 1 minute of a breathing exercise, 1 minute of peace, for example. And when I was feeling stuck, I found that even the smallest of changes created a shift in that I felt I was reclaiming some control. And then there is this ripple effect and this compounding effect. The socio-economic determinants of health, these are the upstream determinants of health. We're shaped by our environment, and this can include our physical environment, our upbringing, our culture. All of these shape our beliefs and our values. All of these influence the small choices that we make each day that affect our well-being. And the world isn't fair. It's a lot easier to make healthy choices when you have access to safe green spaces outside your door. It's easier to get a good night's sleep if your job isn't involving shift work or if you feel safe. Understanding these gives us some context. It enables us or our patients to acknowledge what's outside our circle of control, but more importantly, allows us to identify what is within it and what we have the power to change. And all of this is with compassion and without judgment for ourselves and others. I started to look upstream and understand what led me to my current lifestyle and situation. And I took some time to reflect on what's important to me in life and what my values are. But how often do we stop, get off the conveyor belt of life for a moment and reflect on what's important to us? So this invites a couple of things to reflect on. Our values drive our daily choices, which drive our behaviors, which result in our outcomes. If we're not living aligned with our values, things just feel wrong. It's like trying to swim against the current. I'd invite you to reflect on what's important to you. What are your values? Why do you do what you do? What's important? Is it time with family, doing something you love for a living? Doing something where you feel you're making a difference, having free time? How do you want to be living? What is your why? What's your motivation? How often do we stop and take time to reflect on these questions? But starting with why gives meaning to everything we do. It's our fuel to make changes in our lives and move forwards. And being clear on our vision of what we want and our why helps us live each day with intention, making decisions in accordance with our values, not based on distraction or other people's priorities. And it makes sure that if we're putting effort into something like climbing a metaphorical ladder, it helps ensure that when we get to the top, it was propped up against the correct wall. So to conclude, the main point I wanted to get across today is that lifestyle medicine has many benefits for us as professionals. these positive side effects. Small changes matter. Coming from a place of overwhelm, just starting with a choice to prioritize self-care and one small change can be enough. The ripple effect of that one small change I made was huge, and it led me to being a better doctor, a better parent, a better son, husband, having a diverse career, doing things aligned with my values that are important to me, and getting to work with some incredible people. We all have the power to create positive change, not just for our patients, but for ourselves, our families, our colleagues, our population. And this can start with one small change. And I found that when we embrace lifestyle medicine, we don't just treat illness, we really can transform lives, starting with our own. And that's perhaps the most powerful side effect of all. Thank you for listening to my story. My name's Dr. Adam Smith. If you have any questions, I'll be happy to answer them. If not now, you can reach out to me, either message me on social media or email me. If you want to copy the Wellbeing Wheel, there's a QR code there as well. Please do get in touch and I'll get back to you. Many thanks for listening, and I hope you enjoy the rest of the event.
Thank you. Thanks very much, and welcome, Adam. Thanks for joining.
Hi, Emma.
Thanks for a great presentation. I think the hashtag one change is really such an important message, and you've spoke about this for a number of years on just starting those small habits. How do you do that? Well, often we get asked, how do you have this conversation in such a short period of time with a patient that comes in? How do you help them understand or get to the small changes that they can or are willing to make?
I think part of it is focusing in on what the patient values. So I think that's one of the key things to try to get to the bottom of in consultations. What's important to the patient? What's their driver? Why is it that they want to? Why are they presenting? So are they in pain? Do they want to alleviate that? Are they wanting to control their diabetes for a certain reason? And a lot of it is related to family, being around for family, or being able to be fit and active as they get older. I think really getting to know what the why is a big part of that, because that kicks into the motivation and the and I guess the shift that takes you from being told what you should do to actually, yes, I want to be doing this, so what can I do? The other side of this is that we often think, as I alluded to here, that we need to do something big in order to create positive changes. So and I've had patients whereby the thought of like doing physical activity or being encouraged to exercise is a complete like turn off, because it's something that's completely alien, can't see themselves getting up, having a run or anything along those lines. So it's really the case of seeing people where they're at and getting the appreciation across that the smallest changes can actually make a big difference. And we know from research that when it comes to physical activity, for example, that the people who benefit the most from doing any physical activity are those with the most to gain. And it doesn't need to be running or doing any sporting activity, but just going from nothing to a bit of aerobic activity, even if that's getting up just walking for 5-10 minutes, that can make a big difference. And it's, I think, getting that message across that that empowerment that I can do something about my health. And I think that's been a big thing for me, that small changes matter. It's been big for me. It's also been big for patients as well. One change, don't overburden yourself. One small thing, and it really does help and make a difference.
And so person-centered, like you say, because the reality that many of our healthcare professionals or healthcare workers that are joining us today will be seeing patients that are not trying to become Ironmen. They're trying to be able to walk unsupported around their couch or around their kitchen counter. And so it really is person-centered. And I love that you mentioned there's a lovely graph. I think it's an RCGP graph that shows that about those that do less have the most to gain. And
yes.
If I recall, we've got it on our website under the physical activity pillar, to be able to show that, because it's a great one. Also, you spoke a little bit about, we'll be talking more about that person-centered approach. It might be just the engagement and having this, planting the seed, having this conversation with the patient, because it may be that somebody is looking to stop smoking, and they're finding it very hard to stop smoking, but because perhaps they're not understanding the root cause of why they smoke in the first place. Could you, if it's managing their stress, etc., could you talk a little bit about how you start to dig a little with the patient? Because some may be ready and want to have that conversation, but others maybe not ready to hear any of that yet. It may
Yeah.
sound too big.
Yeah, absolutely. So the behaviours that we do are for a reason. So certain behaviours like smoking or eating the wrong things or scrolling on the phones, we do them for a reason. So our brains are wired to respond to cues, and we maybe have a drink after a busy day of work, and it makes us feel a bit better. So we repeat that, and because we're getting that quick reward from it, so we repeat it, and then the habit gradually forms over time. I think part of it is recognizing what the trigger is, what the cue is for that particular behavior. So it's bringing awareness to that. So why do you smoke? What are you getting out of it? And is there any particular time or trigger that results in you doing that? And can we identify what that trigger is? Can we identify what the emotion is, what the feeling is? And once we've got that, we're in a better position then to think about how we can potentially replace that behavior that's not necessarily healthy long term or at all. What else can you do instead that might give you a similar benefit? What else can you do to help to alleviate stress in those moments rather than the cigarette or the alcohol? There's obviously there's other factors in there as well with the kind of the addictive nature of a lot of these substances. But in terms of behavior change, I think the crux of it is to leverage the why and know what people's why is. And I think that's one of the things I've done a lot more with and taken a lot more interest in patients and people I work with, what's important to them. Why are you doing what you're doing? What's important to you in life, and really try and get a leverage on that, because that can be a powerful fuel and motivation to look at driving those positive, healthy behaviors going forwards. And then you can look into some of these strategies or these other forms where you're looking to see what the triggers are and is there any way we can replace these as well. So yeah, I hope that goes some way to answering that.
Yeah, that's great. Thank you. It talks to what Caroline was asking as well about moving on to the cycle of change. So it's those behavior change skills. Great. And then one last question here. It's more for us. It's just to say it's no problem. Somebody was just asking if it'll be recorded. Yes, the whole day will be recorded and it'll be sent out to everyone registered. So if you need to dip in and out, thank you for that, but we will make sure that you don't miss out. Adam, thank you so much for your time.
Thank you.
We always appreciate hearing from you, and thank you for taking us through to the next break.
Yeah, thanks, Emma, and thanks everyone. Enjoy the rest of the event.
Lovely, thanks so much. Right, we're just going to head over for a short break, and we will meet back here at 10 to 3 for the closing part of our day. Please try and move around, stay hydrated, and see you in 10 minutes. Thank you.
Hi everybody. So we'll reconvene now for our final part of the day today. I'm Kate and I'll be chairing this last part of the day. Thank you very much to Francis and Emma for their chairing so far. So without hesitation, I'll go over to Paul Fox, who's going to be talking about yoga for NHS wellbeing, staff wellbeing.
Welcome everyone. Thanks for letting me speak at such a fantastic event and on a subject that is so close to my heart, the stresses and the risk of burnout facing NHS staff. I'm the guy who helps to teach the yoga sessions at the BSLM conference along with my colleagues at the Yoga and Healthcare Alliance charity, and it's a pleasure to share a few thoughts about staff wellbeing and how yoga can support that with you today. The Yoga in Healthcare Alliance charity offers programs to staff and to patients through social prescribing, but of course we're focusing on staff today. So I think what we'll do first is really understand how yoga works, and then I'll tell you a little bit about the program, and then we will do some practice. So I'm indebted to Professor Satbir Singh Khalsa, who's at Harvard University in America and is the world's leading yoga researcher, for this diagram that really explains the way in which yoga is able to work at a multi-level, holistic way. It's a bio-psycho-social mind-body practice. And these 4 domains that we see here are pretty obvious, some of them really. So fitness, have an abundance of focus on yoga postures and asanas, but that is really not the whole picture. Nevertheless, it will give you flexibility, strength, coordination, balance. The better posture, the breathing practices will all help with respiratory function. So those things are important, but more important is the way in which the whole body systems are regulated. The physiology, the biochemistry of the body is shifted in a very positive way through yoga practice. We see this principally through ANS regulation. So a lot of staff, a lot of people suffering stress, maybe will have long-term chronic sympathetic drive. And the yoga can really help to balance that by kickstarting the parasympathetic response and bringing balance back. And when that balance comes back, when stress hormones decrease in the bloodstream, we also see fewer inflammatory markers. We see higher levels of GABA in the brain, and we see body systems like the immune system working more effectively. So there's this kind of whole body effect because we're really promoting and supporting balance and homeostasis in that physiological sense. In terms of awareness, the mindfulness, the way in which the attention networks are focused and settled, building concentration skills, building cognition and metacognition. And this was the original purpose of yoga, to steady the mind, prepare it for meditation. And so it's still really central. It's probably more relevant today than it was around about 300 to 500 BC when this was first thought to be a good idea. So really long tradition there. And we know that when the mind settles, people are generally happier when there's less mind wandering. There's randomized controlled trials showing that. And when we're bombarded by so much information through our smartphones, through email, through everything else going on, it's just great to turn to yoga and provide an opportunity where the mind can quieten down. And we can realize that that entanglement in thoughts, which can be so toxic, difficult, stressful, actually when we untangle that and all that is left is awareness of those thoughts, is pure awareness and mindfulness, then we come into a different relationship with the mind and with life. There's also spirituality aspects to yoga, which we don't directly teach on our programs to patients and staff, but nevertheless, it needs to be acknowledged. And we often get emails of people saying that they experience things which we might describe in the language of spirituality in terms of feeling very joined up, very unified, deep states of peace beyond normal, usual human experience. So all these 4 domains feed into global human functionality. I just call it skillful living and using yoga to really support health and well-being. So we began with our patient program, and fairly rapidly healthcare staff told us they wanted their own program. So we developed 2 6-week courses, the Yoga for NHS Staff Wellbeing programs. there's the first 6-week one and the second 6-week one are both accredited as CPD by the Royal College of GPs. So we've always gone down the accreditation route, and we certify the staff who do our program as breath ambassadors or with level 2 yoga for health ambassadors. And if they want to, they're able to share the practices, particularly the breathing practices they learn, with colleagues who might benefit from stress release. Or more commonly, they may just signpost those colleagues to our video resources and support. So in 2022, I piloted the NHS Yoga for NHS Staff Wellbeing Programme to about 400 staff, and we're now up to 742 staff, and I'm currently teaching another 60 at the moment, so we're over 800 in fact. And in recognition for me running that pilot program, I was lucky enough to win one of the Our Health Heroes Awards last year of Healthcare Volunteer of the Year. We're very pleased that the program is so well loved by staff, and we have 100% saying they would recommend it to a colleague. And just 3 quick diagrams here. So the first one shows that in terms of stress management, 91% of staff said it had been useful, and 90% said the yoga techniques have made them feel calmer and less anxious. And when asked if the Yoga for Health program had improved their mental health, 82% said it had. I have a couple of quotes here from staff, which I'll just give you a moment to read on the screen. So wonderful feedback. We are currently in the middle of a Westminster University doctoral thesis study of the Yoga for NHS Staff Wellbeing Programme, and that involves a group of 150 staff divided into 2. Half of them are doing the programme with me currently, the other half are not, but they're both being tracked for 6 weeks, and that's going to give us some really good comparison data to show what impact this programme has. And we're very optimistic that it will have positive results, as the patient social prescribing program did in a previous study a couple of years back. So yoga is all about the practice, all about doing it. This is our version of sun salutations, very easy, very simple. We also offer chair versions of all our practices, so it's completely inclusive. And if you want to do the Yoga for NHS Staff Wellbeing course, it's completely free to staff. So why not? It's 6 hours of probably the easiest CPD you'll ever do. The next course starts on the 4th of June. It's 7:30 to 8:30 in the evening on Zoom, live on Zoom with me. So just drop me an email and I will sign you up. So what we're going to do now is, of course, a little bit of yoga. And in yoga, the breath is the prime tool of transformation that we use. So I'm going to invite you to do a little bit of breathing with me. And what I'd like you to do first is just sit nice and tall with lots of length and space in your posture. Now, we're all sitting down in chairs here anyway. So what might go wrong sitting in the chair is that your back's going to round, your head's going to be forward of the spine. There's not going to be a lot of space at the front of the body for your breathing. So you want to fix that. You want to feel like you are moving the top of the pelvis forward. You're tucking the chin in. You're opening the chest, relaxing the shoulders, and bringing the head over the center of the chest, over the center of the pelvis. And then just take a moment to notice how you're feeling. If you don't fancy closing your eyes in such a big group, then just have a soft downcast gaze forwards. And just take a moment to let everything slow down. Give yourself the space, time to notice exactly how you're feeling right now. in your body. Notice all the sensations in your body. Notice the touch of the body on the chair, the feet on the ground. Notice your mind, whether the mind is very active, agitated, whether the mind is very steady and very still. And finally, notice what your breath is doing. What is your current pattern of breathing? Is the breath shallow? Is it up in the chest? Is it further down in the abdomen? Is your breath smooth and flowing? Or is your breath a little uneven? Maybe a little tense? So let's take a little bit of control over the breath. And unless the nose is blocked, we're going to breathe in and out through the nose. And I'd like you to just place the palms on your abdomen and really relax the abdomen. And as you breathe in, try to feel the abdomen being pushed out a little as you inhale. And that's the result of your diaphragm flattening and moving down to draw the in-breath into the lungs. And as you exhale and the diaphragm moves back up to its high dome position, the belly that it has displaced will move back in. That's what we want to feel. That means we're breathing with our main breathing muscle, the diaphragm, and not with upper chest muscles, which is associated with the stress response, with sympathetic drive. Instead, diaphragm is working, tummy is moving out as we breathe in and moving back in towards the body as we breathe out. So maybe you can place another hand up on the ribs and just check that there's little movement there. You don't want a lot of movement in the ribs. That's for when you're doing sport or you need to get a lot of breath in and out of your body quickly. And then if we use this little breathing ball as a visual guide, beginning to really bring a measure of control and flow and ease and steadiness to your breath. Inhaling through the nose, unless the nose is blocked. Exhaling through the nose. And finding a breath that is low, slow, and subtle. Inhaling and exhaling. And just keep going with that for a few more breaths. And I'm going to invite you to think about one more aspect of this. This is what we call simple breath awareness. And what we're trying to do here is to invite ourselves into a rhythm where it's taking around 5 to 6 seconds to breathe in and around 5 to 6 seconds to breathe out. And if we can achieve that, then the breath is going to take in total around 10 to 12 seconds for an inhale and an exhale. And that is going to translate into a breathing rate of 5 to 6 breaths per minute. And the research shows that this is the sweet spot, this is the rhythm to maximize parasympathetic response, the relaxation response, to maximize heart rate variability. And in terms of yoga, to have a really profound and rapid calming effect on the body and on the mind. And to turn this into a really deep and effective yoga practice, just simply sitting with the eyes closed, with the whole of your attention on the breath, and allowing yourself to come into this slow, low, subtle rhythm of breathing. Inhaling for 5 or 6 seconds. Exhaling for 5 or 6 seconds. really focusing on the flow and the softness of that breath as it comes in and leaves the body. Then in only 3 minutes, you will begin to feel a really profound shift. The body will be more relaxed. The mind will be steadier. Your attention networks will have been held in this present moment, not flight of fancy to the future or dwelling on the past. So it's really, really a mindfulness practice. And then at the end of the next exhale, just take a final check-in, notice how you're feeling. And then when you're ready, blink, open your eyes. And that is as simple as it gets. And when we teach the Yoga for NHS staff wellbeing program, we start every session with a breathing practice. That's the week 1 breathing practice. And each week the breathing practices move on. There's more and more texture and more and more science behind the impact that different breathing practices have on individuals. And then the rest of the session each week is to go through a standardized, simple protocol of postures on a chair, on a mat, ending with a nice relaxation, all in an hour live on Zoom, and getting that fantastic feedback. So I hope that that has been interesting, and that the work of the Yoga and Healthcare Alliance, you'll check us out on our website and sign up to one of our programs, and I'll see you on Zoom soon. Thanks.
Thank you very much for that, Paul. That was great, and I feel much more relaxed having done those breathing exercises for a few minutes. So we've already got some questions starting to come in, which is brill. I can see you've already answered the one about is your the yoga that you do trauma informed. I don't know if you wanted to say anything more on that topic now that we've got a more open forum for that.
Yeah, just that it's become a big thing in yoga over the last 10 years, and very rightly so. It comes up a lot with the patients. We've got 550 yoga for health teachers delivering social prescribing programs to NHS patients, and it is basically a lifestyle medicine program, and often there's a lot of trauma in the background to those patients as well. So it's an important area. I won't delve into it any more than that, because it's very complicated, and we'll get stuck there, I think. I'm happy to move on with any other questions. And if I can just make one comment, which is that when I discovered BSLM, it was like sort of coming home. It's how I'd always wanted to teach yoga and to the community that I've always wanted to be connected to. And it's great to hear from people who will already have connections with. Doctors in distress have been mentioned already today, and and I really liked and NHS Practitioner Health. One of our trustees is a consultant NHS psychiatrist working with that organisation. So it all feels very knitted together.
Yeah, absolutely. So the questions that are coming in about the practicalities of joining the programme. So firstly, is the programme free for doctors outside the UK, somebody wanting to participate from Portugal?
Yeah, that'll be fine. Not generally, but I'm happy to make an exception for people on this event. Yeah, that's no problem at all.
How would that person join, just by emailing you? Or?
Yeah, they just basically it's with me, so I'm compiling the email list for participants for the next run of 6 weeks. So as soon as one 6-week course ends, the next one will start. We're currently full with a couple of courses, because Westminster University are evaluating this program for us as part of a PhD research. So we've got I'm doing a 6-week group at the moment, and there's a control group, and then I'll do the control group after Easter, and then when we get to the 4th of June, that's the next course that I'm enrolling for.
Brilliant. Thank you. That's very kind of you to extend that invitation. And then somebody else wondering about if they can't make all 6 weeks, are there any recorded sessions that they could do on Zoom or?
Yes. You know, when I ran the pilots for the Yoga for NHS Staff Wellbeing, I imagine we might be in-person classes because the patient ones always are because they're social prescribing, and I managed to run one course with NHS physiotherapists in Cambridge. It just wasn't practical. It's shift work and everything else. So we went on Zoom, and that's how staff like it. But even then, we generally get staff attending around 4 out of the 6 live sessions. So we have catch-up recordings, which are sent out after every live session, so that if you miss it, you can catch up. Because at the end of it, you sign a form to say you've done all 6 sessions, either live or via catch-up, and that triggers your Royal College of GPs 6 hours of CPD. So yeah, that's the way we're running that.
Great, and great that you can get CPD credit for it as well. That helps with appraisals and things like that, I guess. There was another question someone's asked about, is it always a Wednesday? I can see Thursday the 5th of June is a Thursday, but
It's a Thursday, yeah. Actually, it's Wednesdays or Thursdays. We're kind of switching between those 2 evenings to give a bit of flexibility, so not always on the same evening. So when that June one finishes, the probably one after that will be back on a Wednesday.
Well, thank you.
People moving around like that.
And a question from me now. I wondered about, so hopefully within this room, as you say, BSLM feels like a natural place for you. And within this room, there's probably going to be lots of people who don't need convincing about the benefits of yoga. But how do you, talk to the people that might be less convinced about yoga and to try and get them on side?
Yeah, well, I'm very much about, and the Yoga and Healthcare Alliance is very much about helping people, and it's been talked about today actually, helping people to integrate new habits of short practices. So, it's very hard to make time and space and fit into your schedule, a 90-minute yoga class at a fixed time. But how about doing my 3.5-minute things you can do in your bed before you get up in 3.5 minutes? And how about doing a breathing practice that lasts 3 minutes and fit that in between 2 patient appointments? Or how about doing one of our really short practices? So by having these lots of different resources of varying lengths and focusing on different aspects of yoga practice, we're trying to get people to really engage with the practice in a way that is going to be something that they we call it the personalized yoga toolkit that you carry around with you, a virtual bag. And whenever you need a breathing practice to reduce stress or to recenter yourself, or you're feeling twinges in your back, you've got something you can go to and use that's very, very accessible, doesn't take much time, and is a really useful tool.
Great, thank you. That does sound really useful, and it kind of fits with what Christine was saying earlier as well about making, when you're starting a new habit, trying to make it something that's easy to achieve in the first instance. So a couple more questions around the practical side of joining your course. So do you have to be an NHS staff member, or can you be a health practitioner not working for the NHS?
It is for NHS staff. That's the whole purpose of it. Anyone in that category, drop me an email and I'll see what I can do. Officially, it is, we're working with NHS infrastructure and NHS England and things, and that's how we've presented it. And that's our accreditation with the Royal College of GPs is on that basis. So there can be exceptions. So I'll do that on a case-by-case basis.
Thank you. And then another one similar, if we're not a doctor, but on today's session, can we still join?
Yeah, I mean, we're literally anyone working in NHS, from people who might be working on reception in any kind of role. We haven't sort of said that we want particular categories of staff. So anyone working in healthcare for the NHS is welcome. Because one other thing worth saying, it's all about sustainability. So obviously, if we can get the patients to self-care and adopt lifestyle medicine, that's going to really support a publicly funded health service. But also, if we can support staff to avoid burnout and to feel less stressed, because nearly a third of staff off sick on any given day are off for those mental health reasons of stress and anxiety and overwhelm. We're trying to help with that as well, and that covers all staff.
Brilliant. And then a question from Simon. He's a qualified yoga teacher looking to further share his practice. I live in Powys, Wales, a very sparsely populated area, and I don't think there's anything like what you do available to NHS staff in my area or delivered as on a social prescribing basis for patients as a group intervention. Should I get in touch with you about how I might share what you do in my area?
Yeah, so thanks for the question, because it enables me just to mention that there are so many healthcare staff who are also yoga teachers now. I was amazed. I was at the yoga show and I signed up 28 people for the staff wellbeing program at that show alone. So that was the number of NHS staff who are also yoga teachers who happen to walk past my stand. So what we offer for yoga teachers is a 60-hour professional development course, which is accredited by the Personalised Care Institute, and that enables them to then deliver our 2 protocols, one for patients and one for staff. So that's the information that I can provide to anyone who would like to do some training with us. We've actually got a training course starting next week, but that would be way too soon because there's 25 hours of pre-course learning, but we run it twice a year, so we'll be going again in October. And that's 4 days on Zoom, 9 a.m. to 5:15 p.m., a little bit of assessment, and the 25 hours I mentioned.
And what would someone be able to offer off the back of that? Someone who's already a yoga teacher, and then it's to be able to deliver this to patients or to staff?
So it's then that entitles you to deliver the Yoga for NHS 10-week social prescribing program to patients, and that itself is based on the Yoga for Staff Wellbeing is based on that same protocol, because that sits on a very excellent Westminster University evaluation of 300 patients in West London, showing remarkable results. So then you would learn how to adapt it to make it work for staff as well. Thank you.
And then finally, I think, because we're almost at time now, actually, it's great to see so much interest. So somebody's asking if is there a separate sign up because with reference to today's webinar, because they've been on your website and they're wondering if there's a separate sign up for attendees today.
No, just drop me an email. It's still, if you look on the website, it says next course is that one in June, and again, it'll just direct you to my email and back to me. Everything loops back to me in terms of the staff program.
Brilliant. Well, thank you very much, and I've really enjoyed hearing about your work. It sounds really excellent. I'm look out for you at conference this year as well. So yeah, thank you very much, and we'll go to our next speaker.
See you in Brighton.
See you in Brighton.
Thanks.
So our next speaker is Sahana Olety, speaking about caring for the people who care, systemic interventions to avoid burnout. Address burnout, sorry.
Thank you, Kate. I'm just trying to share my screen. Yeah. Hope you can all see. Can you all hear me and see me? That's great. Thank you. Yeah, thank you. So thanks everyone. It's lovely to hear from this morning all different aspects of self-care and lifestyle. I hope you're all not too tired, and I feel this talk should have been in the beginning of the day, but nevertheless, you can always go back to the recording. My name is Sahana Olety, as Kate introduced me. I'm a consultant pediatric psychiatrist, and the talk is about caring for people who care. For the next 20 minutes, I would like you to kind of step out of yourself, think about your roles as kind of more clinical leaders, managers, and in your roles as how you would usually support in a day-to-day basis. How will you recognize kind of burnout there? So why is this topic kind of a bit dear to me? As some of you have kind of known, I work in camps. I'm both a frontline clinician and also a clinical director, and you may have come across the pressures and pressures on child and adolescent mental health services. There's almost a crisis in child and youth mental health in the last 5 years, isn't it? Our referrals have doubled, if not have tripled and quadrupled in some of in specific kind of conditions, and our resources remain the same. This brings huge amount of pressure, and our staff burnout rates are significantly kind of more. And having those kind of real insights into our staff survey results and trying to do some systemic interventions, these are all quite active in our teams, and I thought it's useful to share these insights with yourselves today. Okay, so let's kind of move. Oh, one sec, my slides are not moving. Sorry, 1 second. I can't move my slides. Oh, yeah. Okay. So this is the outline of the talk today. I'll cover these topics. First thing, we've heard a lot from this morning about, burnout. So I'll go behind a little bit into the science of burnout, understanding burnout. How would you recognize signs of burnout in yourself? And we'll kind of think about, scope of the problem. We've heard about statistics and things like that, where it applies and, how far it goes, recognizing burnout, not only in yourself, in your colleagues, in your staff. And then we'll delve into some of the systemic factors that, contribute to burnout. We've talked about a number of individual kind of risk factors from this morning, a lot of self-care and how you can be resilient and look after yourself. But all that can only contribute to so much. And but it's really important to be aware of systemic factors that contribute to burnout to provide to really address this issue of burnout within our kind of health and care systems. And we'll also delve into some of these kind of systemic interventions. There's good evidence-based research frameworks and approaches, and we can see what we can, take away from those. Okay, so the first thing to kind of begin with, what is burnout? Yeah, we've talked a lot about it, but this is how the World Health Organization defines burnout. There are 3 key components of burnout. One being emotional exhaustion, the depersonalization, and that kind of also results in reduced personal efficacy, feeling of being ineffective at work. So how can this present? Going back to the definition itself, you can see that burnout is an occupational phenomenon that's caused by chronic workplace stress, that's been successfully managed, that can kind of make us think and reflect what would successfully managing burnout would kind of, look like. That's a point to ponder about. And going back to the details of, how would you recognize burnout in yourself? How would emotional exhaustion look like? How would it manifest in you? If you're kind of frequently experiencing fatigue, insomnia, impaired concentration, some people may have physical bodily symptoms, whatever they are, and, you might succumb to repeated illness, loss of appetite, symptoms of depression, anxiety, anger. I'm sure we all experience this from time to time. And, if that parallels alongside, not enjoying your work much, and, feeling detached from yourself, your colleagues, and your patients, and having this kind of irritability and lack of productivity. We call it kind of imposter syndrome, or the lack of productivity can also manifest as, absenteeism, or sometimes presenteeism. Like, you are present at work every day, but your kind of staff are quite disengaged. That's a common symptom of burnout as well. Okay, so the next, I'll move on to kind of just defining the scope of burnout. Yeah. So the WHO clearly kind of defines that burnout is an occupational phenomena. So is it only an occupational phenomena? Where do we see this? The burnout, is commonly seen in a number of caregiving professions, healthcare, social care, frontline educators, police force, a number of these organized caring professions, especially professionals are at more risk of burnout. Why are kind of, caring professionals are more at risk of burnout? You may have come across, or, the psychological science that explains is, compassionate fatigue. So the jobs that we do generate, we work with people, where the jobs that we do generates lots of emotional baggage. We're dealing with illness, we're dealing with suffering, we're dealing with trauma, we're dealing with lots of distress. You're meeting some patients who are distressed, some families who are distressed, children who are distressed, and you are kind of continuously caring for them. And what does compassionate fatigue look like, and why does it commonly happen? Like, if you don't have an opportunity to acknowledge your emotions and express them, and if you have to constantly suppress your emotions and act in a transactional way, there's more risk of compassion fatigue. It's commonly seen in therapists, or like commonly seen in people like, or spouses of the people who live with people who have mental illness, where, you can't, it's not always useful to express your emotions. Constant suppression of the emotions and working transactionally sometimes can result in compassion fatigue. There are a number of causes, that's kind of a little bit in brief. And do we see burnout outside of work? Is it purely an occupational phenomenon? Although the WHO says that, and there's one school of thinking that it's purely an occupational phenomenon, but, a number of psychologists, the psychological science is quite advanced in this area. Lots of researchers, psychological scientists, again, see this outside of work, very commonly seen in caregivers, even in our parenting roles. In my world of work, I commonly see it in, parents who are parenting children with high level of needs, like, parents of autistic children, and caregivers who care for patients with dementia. The burnout rates are really high, and how can it manifest in the, in the caregiver role or parenting role? We can see that when parents are burnt out and when they are experiencing that emotional exhaustion, so it can result in a bit of apathy. It can result in, depression and anxiety, depressive or anxiety symptoms, both in parents and also in children. And sometimes, occasionally, it can also result in a situation of, neglect and harsh parenting. And similarly, we know that 60 to 70% of the caregivers who care for, patients with Alzheimer's dementia, they experience burnout. Yeah. So it's well studied and well researched, even in the outside of the world of outside of the world of work, in the world of caregivers, parenting roles, and a number of caregiving roles like this. So what is the impact of burnout? We've all heard from this morning the statistics of, at any point in time, we have about 1/3 or more than 1/3 of health and care professionals, expressing burnout. The impact is ultimately patient care. We're only as good as how well we keep ourselves. And if we are burnt out, it can come in the form of, medical errors, poor quality of care, risky decisions. Ultimately, we have to look after ourselves and look after our system to be able to do a good justice to the patients that we care. Yeah. So let's move on to the next one. So, till now, like we talked about, how would you recognize the signs of burnout in yourself? wanted to think of a model, how you can, recognize burnout in your colleagues or in the staff that you're kind of working with, you're supervising, so I found that, this kind of stress Apgar model defines it kind of really well. The Halliwell and colleagues who did a really big review, they come up with this model, I think, which is quite nice and easy to remember. Some of you, like medical students or doctors, are kind of here who work with children. You know about the APGAR score that we use in neonates. They've used the acronym APGAR to kind of remember. So what would you notice in your colleagues if they are experiencing burnout? You would obviously notice the physical signs of stress, fatigue, change in demeanor, and you will notice changes in their work efficacy. And you would notice that the members of the team are feeling overwhelmed, or they're feeling under-challenged, and they're not being really productive. You can see the affect or the mood changes, the emotional dysregulation or emotional regulation becomes hard in them. It's particularly, what particularly you would notice is irritability and mood swings. Yeah. And relationships, how does it manifest in relationships? So the interpersonal interactions become really hard. So it either results in, lots of conflicts or a total disengagement and social withdrawal. So if you notice any of these things in your colleagues, you kind of, that's one opportunity to kind of step out to kind of help them. Then a little bit about the science of burnout. So the neurobiology of burnout. So what is happening, what will be happening in our brains when we are experiencing burnout? The first area, so the neurobiological changes, it starts with the prefrontal cortex. We know that, this is the kind of the main modern, neocortex that's kind of really important for attention, flexibility in thought and decision-making. So thinning of the prefrontal cortex will result in decreased ability to focus, quality of medical decision-making can suffer. And there's, we are more prone to making kind of, errors. You may have heard about the word executive functioning. Our prefrontal cortex is the one that's kind of really kind of a key area with attention and problem solving, flexibility, task shifting, and working memory. Working memory is one of the key function, and our prefrontal cortex needs to be sharp for our working memory to be kind of doing a good job. So the second part, we know the basal ganglia, that kind of controls the motor system, the fine motor skills may be affected. This is where kind of we are more kind of prone to accidents, or even like driving accidents, and, can kind of result in these situations. And the last one, the amygdala, our emotional center, our emotional brain. So because of increased reactivity to stress, when amygdala enlarges, we are so overwhelmed with the emotions, the symptoms, mainly anxiety. So like what we commonly see in, people who are, who have the ADHD neurotype, the executive dysfunction, but we can also see that, people will develop anxiety-driven executive dysfunction, which means neurobiologically, your prefrontal cortex changes. So your working memory becomes poor and your attentional focus becomes poor, and you will act as if you are a person with ADHD, although it could be, when you have an enlarged amygdala, anxiety-driven executive dysfunction. Yeah. And the last area is the hippocampus, which is our memory center. There's a risk to our short-term memory and long-term memory. Yeah. So that's an interesting concept. If some of you are kind of, interested in kind of, reflecting in your own workplaces, what can keep our working memory sharp, and what can increase kind of the load, and how can we influence a system to reduce the load on our working memory? So the cognitive overload model, the intrinsic load, because as medical professionals or health professionals, caregiving professionals, we are prone to burnout because intrinsically the nature of the work we do is complex. It involves a lot of, cognitive flexibility and decision-making, multitasking, emotional decision-making. Our jobs are complex enough. And then the germane load, what we call is like when we have to imbibe any new information, when you have a goal-oriented task, then you start learning new things, and they also kind of tax the working memory. So the first two are unavoidable. The nature of the jobs requires multitasking, emotional decision making, complex decision making, and learning new information and acting. The last one is, the external kind of the load. This is the bit that can be removed or lessened by automating processes, by having a good structure, flow, administrative support, and by the design of policy and organizational structure. This load can be reduced, so our working memories can be protected and we can be at less risk of burnout. So the next one is about it's about reflecting on causes. What causes burnout? This model is very famous in very popular in medicine, isn't it? Like, when we talk about the social determinants of health and upstream factors, similarly, you can apply the same analogy here. On the surface, what we see in staff or in ourselves is all these signs and symptoms of burnout, but what exactly causes burnout? So yes, some individual factors matter, like, the burnout is relative to, will individual factors kind of influence burnout, like, age, your gender, your sexuality, all these EDI, diverse characters like neurodiversity and your stage of career, your race and ethnicity, lots of things can influence, but individual factors can only influence so much. Even if we are like 100% resilient, there is a ceiling effect. Without addressing systemic factors, we can still succumb to burnout. So here are kind of the key systemic factors, that result in burnout, the organizational and workload pressures. This is the most common one, isn't it? Like, working in departments which are understaffed, excessive workload. And when I say excessive bureaucracy, the amount of administrative work, that taxes our working memory. There are organizations like, which provide solutions like having like an assistant for managing electronic patient records or documentation. That itself, has a potential to kind of reduce a bit of cognitive overload and risk of burnout, and lack of autonomy as well. And workplace cultures, where we find various form of discriminations, microaggressions, and a culture where there is kind of blame and less room for psychological safety, that can kind of result in, a system that's more prone for burnout. And at a structure and the policy level, sometimes, frequent structural changes, sometimes, commercialization of healthcare, that may go against our values. Sometimes, the long-term chronic underfunding of health services, where we feel helpless, we are at kind of the risk of more kind of, feeling that, there's that moral injury that we cannot do a good job and we're not doing a good job. And, the policies which are like short-term and have less insight, they can all kind of contribute to burnout. And some of these upstream factors, which are kind of, again, not in our kind of gift of control, the austerity, societal austerity, the work-life imbalance, societal expectations of the role of healthcare professionals, sometimes, expecting us to be superhumans, providing, solutions and, to their problems. All these can contribute. All these are some of the systemic factors that can contribute to burnout. Yeah. So let's move on to some systemic interventions. Yeah. So from this morning, you've heard a lot of individual kind of interventions, and even from, lifestyle medicine kind of accreditation, core accreditation perspective, it's useful to think about how we can support organization to implement these interventions in a scalable range within the organizations, because they are likely to have more impact alongside kind of, helping people at an individual kind of level. Some of you have come across, this report is, this report was commissioned by GMC. It's in like 2018 or 2019. The professor of organizational psychology and Dame Dennis Koya, who's a consultant psychiatrist. They came together and they put forward this really, really good evidence-based framework. They called it, this was commissioned by GMC to address the burnout rates in doctors and also medical students. They're very high at high risk of burnout. Nearly 40 to 60% of medical students experience burnout at any one point in time. This is very applicable, although they've written it for doctors, this is very much applicable to all healthcare professionals and all caregiving professionals, and the model is kind of, quite useful. It stems from this theory called self-determination theory, the core human values, and it's put together in a simplistic way, how we support individuals' autonomy, like, healthcare professionals' autonomy, the sense of belongingness, and, the sense of contribution. There are good tips, and there are kind of examples for all these from some of the NHS trusts which have implemented, and the ways of implementation and results, and loads of worked out examples from Trailblazer sites are there on the website. Yeah. The second one, the second kind of really useful tool or a framework to think about, this has been kind of really revived in the recent past, post-pandemic, is the NHS health and well-being, framework. It kind of largely addresses a number of factors, including, the type of the leadership, so in healthcare, we all know that compassionate leadership reduces kind of burnout in organizations and influences the culture positively. And this talks about creating healthy working environments. In lifestyle medicine, again, we talk about the social connections, the peer connections, the trust, and creating a space of psychological safety, the sense of belonging. These have to be embedded, within the teams and structures that we work, and support for, again, mental and, physical well-being support. The physical well-being from your kind of, your workstations, whether you take lunch breaks at work, and, can you nip out for 20 minutes for, fresh air? There's a number of things that can be done and promoted, by the leadership team, by the managers, and, structures can be embedded within the system to address some of these, and also to kind of reduce bureaucratic burden, the administrative support. Sometimes digitization, it has both pros and cons, but kind of automating some of the tasks can kind of, reduce a bit of a contributing factor towards burnout. So I thought I'll touch upon, a little bit of, going back to my previous slide again, this framework is widely available, on the NHS Health and Wellbeing kind of website. Every region has a recognized kind of health and well-being guardian. There is a toolkit, there is a strategy, there's an implementation plan, and the link here in the slides, you can, these can be, put in the chat. So this has really worked out examples of some of the NHS trusts who've implemented, and that gives like really food for thought to take it back to your own organizations and your own workplaces. So for the next 5 minutes or 5 to 7 minutes, I want to kind of really touch upon the science behind all this, which, like, in my kind of passion towards lifestyle medicine, how it beautifully brings everything, whether you're GPs, whether you're hospital physicians, whether you're kind of nurses, psychologists, physiotherapists, whoever you're kind of working in this field, understanding this science and having this awareness can make a huge difference in whatever roles you have within your kind of health and care organizations. Some of these, all these evidence-based interventions proposed by, the ABC framework in the Michael West report, or the NHS Health and Wellbeing framework. The first one is the mindfulness-based intervention, the compassionate leadership. The underpinning science is mindfulness. I've kind of authored, if any of you are doing the core accreditation, I authored this module on mental well-being and the toolkit, so the very popular model for kind of remembering and understanding mindfulness is the IAA model, intention, attention, and attitude, where intention, having an intention to be in the present moment, and giving attention to the present moment with an attitude of openness, curiosity, non-judgment, and with an attitude of compassion. how can I take a compassionate action to alleviate suffering? That's the core of mindfulness, and that's a core of compassion as well. How do we practice self-compassion, and how that can be implemented in leadership? How is this science implemented at an organizational level? There's, again, loads of evidence. MBSR is an evidence-based kind of program. Organizations which provide lunchtime booster mindfulness sessions. MBSR is kind of 8-week sessions. Those organizations who provide these like lunchtime half-hour sessions, there's kind of good reduction, 40% reduction in staff burnout and improved staff well-being. That's some example for one of the tools that kind of, one of the tool and technique the lifestyle medicine kind of proposes. The second one, the science of positive psychology, the PERMA model. I don't know if you've heard about it. If you're already doing lifestyle medicine, we talk a lot about positive psychology, the PERMA model where, we all enjoy work. When the work we do is based on our strengths, when we can be in flow state, how can this be implemented at the organizational level? Again, positive psychology talks about the science of gratitude, recognizing and rewarding employee contributions, appreciation. That's using the science of gratitude. Job planning, job crafting, where you do a job plan based on the employees' kind of strengths and values. Is this aligning with their strengths and values? That's about how do we support their competence here. That reduces the stress. That's kind of how the science of positive psychology is used. Again, sense of meaning and purpose, that's a big aspect of science of positive psychology. And we talk about that in lifestyle medicine when we talk about the mental well-being pillar. And we all kind of value, we all sign up to work in healthcare or care profession. When any staff survey is done, people will say, why do you sign up to do this? Because everybody will say, because I want to make a difference. People find meaning in their work. And the second reason why people sign up to work in big, NHS, it is an incredible institution. People sign up because there's a rich MDT culture. You can work in multidisciplinary teams. There's social connections, the positive peer support, peer reflection groups, peer supervision, that sense of belongingness. That's kind of key why people sign up to in the first place to work in these kind of stressful kind of professions, or because it gives them meaning, it gives them sense of purpose. And translating that to practice, how does this look like at an organizational level? How can we nurture kind of a space of psychological safety? This has to be implemented in kind of policies like zero tolerance policy for any discrimination, no blame culture, establishing peer network groups, establishing restorative supervision, reflective supervision groups. One of the things that I'm very, very fond of and is very good, very well evidence-based is Schwartz rounds. For those who have not heard about Schwartz round, around 200 NHS trusts, run them on a regular basis. Point of Care Foundation is your key contact. It's been well researched, well studied. Schwartz round is about a structured group MDT session where health or care practitioners will talk about the emotional and social aspects of work. Sometimes, the work generates a lot of emotional aspects, sometimes emotional distress, and, sharing that in a wider forum with skilled facilitators, the evidence shows that, the organizations do very well in terms of staff retention, staff well-being, and staff burnout. Those who implement the Schwartz round in their departments, at least, staff should be encouraged to attend these kind of forums at least once a month, where opportunity provides on a face-to-face basis, and evidence shows that it can have a huge impact. The last but not the least is the science of trauma-informed care. Again, if you're in the field of lifestyle medicine, for the physical health, we learn a lot about adverse childhood events and how the trauma impacts every aspect of health, not only mental health, but also your kind of oncological conditions, immunological conditions, metabolic conditions. Our body keeps the score, and trauma impacts everything. So the organizations as such are very prone to experiencing trauma, a collective distress, whatever happens to the organizations, frequent structural changes, a number of things, organizations can be experiencing this collective trauma. Again, if the policies and the structures are very well, trauma informed, you could look back into the science of trauma-informed care again at an organizational level. It has a nice kind of 6 to 7 pillars about how we enable kind of the trust and credibility and consistency and the peer support and empowerment of staff and autonomy of staff that can all contribute to well-being and reduction of burnout. So that's kind of a lot of information to take, but you can research all these topics in your own time, but I'm sure you'll find them useful, and a number of them will have practical applications into the area of work that you're working. Just want to end this with the key takeaways. What are the key takeaways for healthcare leaders? If you are a healthcare leader, manager, please shift your focus when you want to address burnout. Shift your focus from individual to system level solutions. And the second one, we have to work on implementing compassionate leadership and think about systemic intervention and workforce planning at an organizational level. And the last thing what we can do is reduce unnecessary administrative burden on, the frontline professionals in whatever way possible. And what's the key message, for us as, frontline clinicians and healthcare professionals? We have to recognize that burnout is not our individual problem, so how much ever we try to make ourselves superhuman, super resilient, we will be vulnerable to experience burnout when we have this lifespan career in medicine or in healthcare. To match our health span to the lifespan, we have to really be aware of various factors, recognize the signs and symptoms in ourselves, our colleagues, and recognize that, it's a system issue and not an individual kind of issue as such. We have to really actively advocate for better workplace policies, and we have to seek peer support, offer peer support, take opportunities, to be part of these reflective spaces, to heal and take a break, kind of like, give that time for recovery. We heard a lot this morning about, how planned sabbaticals work. Again, in my world of caregiver burnout, we always talk about parents having respite care. You always have your kind of, even in your parenting role, your grandparents, aunts or uncle, they gave you respite, and you've automatically recovered in 2 to 3 days, just taking a break from everything. Yeah. But these kind of spaces can kind of really help. And those are my last 3 take-home messages. And there are some references and resources, that can be shared if some of you are interested. And that's the end of my talk. Thank you.
Brilliant. Thank you so much, Sahana. I think it's been a really illuminating talk for me. And I think really refreshing, because I think when someone's suffering from burnout, it can be very tempting to, reflect internally and think, how could I have done better? And actually thinking around the systemic forces that might have contributed to it is, helps remove the feeling of blame from the individual as well. We'll come to questions for Sahana in just a minute, but I just wanted to encourage you, if you have any key takeaway messages from today, to put them in the chat as well, and we'll be collecting those, and then put any questions for Sahana into the Q&A. We've also got a feedback link for you to feedback on the session as a whole today, so please do fill that out. But Sahana, I wanted to ask, do you have any suggestions about how to have a conversation with someone who's feeling burnt out and they feel that they can't stop as it's all still waiting for them? How do you get them to stand back and see the benefit, or how do you get them to take a step back and a break and get them to see the benefit of standing back to refresh and renew themselves?
Yeah, so you've you've used a very useful term. How do you stand back? Isn't it? That's the key word, to kind of just notice and just not jump into a problem-solving mode, So because we are doctors and healthcare professionals, we have this fixing mindset, isn't it? And sometimes we want to, whenever we see a problem, we want to quickly jump in to kind of fix the problem. Again, the message goes back to the principles of compassionate leadership. The first element of compassion is active listening. And when you notice somebody, when you notice these symptoms of emotional exhaustion or fatigue or irritability, or sometimes it may manifest in performance issues in terms of, not doing work well or doing some errors or whatever, I would say, oh, do you want to just have a chat? And without providing any solution, just give a very good active listening. And I think the answers will kind of span out from that. That's kind of the first step. Then you can figure out, is this a symptom of burnout? Are they talking about system? Are they talking about themselves? They'll open up if we give that non-judgmental active listening, and then that will guide us to take, okay, how can I be helpful here? Even just kind of validating their concerns is alleviating their suffering. So I would say, before jumping into the problem-solving mode, before being judgmental about their performance or health, or, oh my God, you are burnt out, even that can be felt, be taken, very sensitively for people who are kind of like really burnt out. It's like, oh my God, I'm such a non-resilient professional. We all want to be thriving, isn't it? So, but I think active listening and validating their experiences, being non-judgmental, and kind of just taking a small action to kind of alleviate their suffering in whatever way possible, before you do the big things of, okay, do you want to have a chat with the manager? Do you want to see occupational health? Do you want to have NHS practitioner program? You want to have this, because everywhere we are promoting lots of resources, isn't it? So I think if we step back, like you said, step back, listen actively, and just validate their experiences, that you've alleviated their suffering. Yeah.
Thank you. I think that's really good advice. And I was wondering also, how could delegates who are here today, how could they work together to advocate for better workplace policies? Have you got any examples that you're aware of kind of staff advocating for better workplace policies?
So I think I'm in Manchester. I'm in the NHS secondary care system, so, well-being is talked, well in the NHS trusts, and there's always, like, all NHS trusts ought to have health and well-being leads, occupational health departments, and there are staff forums, there's like, there will be staff forums in each organization, isn't it? There's neurodiversity staff forum, there's like, gender diversity staff forum, and the non-execs in the trust will often be like, promoting. There's like usually freedom to speak of guardians. And I think interested people should buddy together. Like say in my trust, like the way I started was, I had my whole interest in this started like, about 5 years ago, because I was well-being lead to look after the foundation doctors, careers and well-being lead. And I started researching into what is well-being, how do we do this, more efficiently. And since then, people are looking for solutions. Like, if I speak to medical schools or foundation schools or the trust, they've always given me like small grants to kind of trial different programs and pilot myself. Like one of the programs I piloted was like, the CHIP, the Complete Health Improvement Program. So we got like an educational grant of about £5,000 to kind of, we did a small group for educators and trainees, and we have like, really good, it was well enjoyed, and, lots of things to learn from the pilot. We did that group like between 5 to 6 outside of work. And like, I've learned so far that nothing that you do outside of work will have good attendance. It has to be embedded in the work hours, and it has to be part of their kind of the need, almost, it has to be part of your appraisal record. What have you done, this year in terms of your health and well-being? So I'd go back to the leadership team, and I'll give them evidence-based. I'd give them, examples from the pilot studies, and I'd show them how the organization can benefit, because they are like, organizations are looking to prove in their annual reports, quarterly reports, how they can provide meaningful interventions. And I think lifestyle medicine society and staff who are interested in people who are interested can provide great solutions and show the evidence. And yeah, we may have to come together, work together, create that pool of evidence and little case studies and pilot studies to kind of have that kind of ripple effect from one to other.
Thank you. Very uplifting message to end on, I think, about how we can change things. So thank you so much, Sahana, and thank you. And I'll bring the day to a close now, because we're at time, and we know how important it is to allow you to leave teaching sessions on time as well. So thank you to everybody who's contributed today, to our excellent speakers, and also the BSLM team who've worked really hard behind the scenes to make sure that this day is a success. Don't forget to fill out our feedback link, as I said. And yeah, thank you so much also to the attendees and all of your engagement and questions.